आशा तुम्हें मिस कर रहे थे.
Hello.
Yes.
Yes, yes, sir.
So, good evening, everyone. On behalf of Sexual Medicine Committee and Adolescent Health Committee of FOXI, myself, Dr. Neeraj Jadhav, along with my Dr. Supriya Jaiswal, welcomes everyone on today's webinar that is on the adolescent health. I sincerely thank our President Pai sir, our Secretary General Madhuri Madam, our VP, especially our VP in charge Asa Madam and Sampat Kumari Madam in charge of the Adolescent Committee for their enormous support in all our activity. Adolescent health, we all understand how important it is for society as well as for nation. Adolescence is the period where so many changes are happening in their life, but due to not enough guidance, they are facing so many issues. Sex education is the only answer to develop healthy sexuality in our adolescent, but due to so many factors, we are not offering them proper sexuality education in our school and colleges. So I hope we as a FOXI member and as a society of FOXI, we have so many things to do for our adolescent, and we can guide them in better way so that they can have a better sexual health as well as overall health in their life. So without wasting much time, I once again welcome all of you, and I hope you will enjoy today's session on the adolescent, and I welcome Supriya to further proceeding.
Thank you, Neeraj sir. At the outset, a very good evening to everyone and warm greetings from both the committees, Sexual Medicine Committee and Adolescent Health Committee, for this wonderful webinar where we are able to connect with the President, Secretary General, then all the VPs and all dear friends across India. So we are really very happy and overwhelmed for this webinar. And well, once again from my side also, a warm welcome to all of you. So still, sir will be joining. Our President Dr. Pai is joining. So, Dr. Neeraj sir, would you like to invite Dr. Madhuri Patel, madam,
Yes.
for her words?
So I don't think I need to introduce Madhuri Madam. We all know she is the first secretary, woman secretary general of our FOXI, and she is always there. Whenever I ask for her for any technical support from the FOXI, she is always ready to support us for all our activities. So I welcome Madhuri Madam, and please bless us with your kind words.
Thank you, Neeraj. Anytime you require anything, for that matter, any of our chairperson, VP, and any of our members, I am always there to assist you. So thank you very much, Neeraj, for your kind words. Respected our President, Dr. Rishikesh Pai, who is a most dynamic, visionary, and after working with him for 7 months as a president, I have been working with him since last 30 years. But with this president post I'm working, I have added also other adjective, innovation. He is a very innovative. And once the innovation is done, he likes to implement, which I've seen in last 7 months of his presidential post. And that's why I congratulate him from bottom of my heart. Then we have our all vice president, one my great friend, Dr. Asha, Sampat, Hitendra, Yashodhara. And one more I'm forgetting is Dr. Sampat Kumari, and I've taken
Alka madam.
Dr. Alka madam, yeah. I've not seen her because I cannot see. And of course, our most brilliant chairperson, Dr. Neeraj and Dr. Supriya. And today's program is of their committees, program that is sexual health and the adolescent health. So this is very, very important. And all my dear friends who have joined, I can see Dr. Vani, Dr. Charu, then Apurva, and Dr. Roma, and other people, and many other delegates. Very good evening to all of you. At the outset, I would like to thank Dr. Rishikesh Pai, all vice president, and our chairperson for giving me this opportunity. FOXI is the most vibrant, prestigious, and one of the largest OBGY organizations in the world with 266 member bodies and 40,000 plus members committed to women's health. I will go further that what this CME is, that adolescents health as well as the sexual health during adolescence. Very, very, very common, but uncommonly talked about it. We know that the 1/5 population of India is of adolescents. The adolescents are neither coming in the age group of children as well as nor coming in the age group of adults, and they have minimum medical problem. So this group is ignored, but they have so many problems. We know they have a menstrual problem, they have a health problem as far as the nutrition is concerned, they have a drug abuse problem. So, and of course sexuality, because as the girl is getting educated more, now they have become a career oriented, but the age of sexuality, that marriage part has gone beyond, but the development is there, and therefore they end up with many, many problems. And therefore, we are here to take care of these problems. We are going to make them sensitized. We are going to make them aware that they don't fall in a problem. They don't develop drug, addiction. They don't develop any sexual problems and the disease related to sexual problems. So here we are here where, all our members are going to get benefited. And we have an excellent speakers, chairperson, moderator, and panelists who are going to enlighten on this topic, and it is going to help in our day-to-day practice to educate these our girls and prevent them from the drug abuse and especially sexual health problem. So now I really congratulate Neeraj and Supriya for the most apt webinar, and I wish them best luck for future endeavor. I would like to stress upon as a Secretary General that now the election are going to start from 1st of August. And there is very, many agony from many of the members and the president secretaries of our member bodies. Why our names are not included? Because we have locked the system, because it will go to the third party for the preparation of election. So we are locked on 16, but actually we locked on 17 for updation of the data, which we have informed each and every member, right from 1 month, since 1 month, but still now I'm getting a request. So we have already sent the list to the concerned person, and now it is locked, we can't do anything. So we have to start from 1st of August. One more thing is that the many societies, president, secretaries are almost, I will not say argue, but they are requesting me to put them in a, election voter list of their members. But reason is that they have not paid money before 31st of March. Our constitution clearly says that if you don't pay subscription before 31st March, you will not get voting rights, but you will get all the rights, like you will get journal, you will get information on all Foxy, you will get a CME, everything you will get. But as far as the voters are concerned, the voting rights will remain if you paid your subscription before 31st of March. So wishing you all the best, and to me also for the upcoming election. Last year it had gone smoothly. This year also it will go smoothly. I'm very confident about it. And we all are here to solve the problem and not to create the problem. Thank you very much for giving me this opportunity.
Thank you, Madhuri madam.
Thank you.
Sir is
very
there.
much, ma'am. Sir has joined.
Yeah.
Sir has joined.
Sir has joined. Yes, yes, ma'am.
So thank you, sir, for being the chief guest of today's webinar, and thank you for joining. So just to formally introduce Pai sir, sir is the president Foxy at present. He is the recipient of so many of awards, received 59 awards, including honorary FRCOG fellowship awards, and many more like IMA award, MOX, BN Purendere, Kanak Goyal Community Service Award. He has also held positions in past Secretary General, Vice President, Deputy Secretary General, and many more. Past President of SR, IAGE, Mumbai OBGY Society, Assistant Treasurer, Director, Corporate Affairs, then Adjunct Associate Professor, Past Professor D.Y. Patil Hospital, and Founder Chair, Indian SIG, American Society of Reproductive Medicine, ASRM, and JGES. Sir is a very friendly person, very humble, and we are very happy to have you as a president. Sir.
Thank you, Supriya. Thank
Yes.
you for calling me. Supriya and Neeraj are very important chairmen of our. We have 28 chairs, and they are very dynamic leaders, I must say. I would like to say hi to Dr. Madhuri Patel. She has already told you everything about adolescents and sexualities. I will not get into that part of it. You know, she's a very hardworking and now
Sir, we can't hear.
all the vice presidents are there. Can you hear me?
Yes.
Yes,
Yes,
yes, now.
Yes, sir.
Yes.
Yes, sir. You are
all the
audible.
vice presidents are there. So wish you the very best for a great seminar. You know, बहुत कुछ actually ना रह गया है मेरा करने का. One of the things I wanted to do was to get this Neeraj's sexual medicine thing on the online. So what I was, I have already thought of it, Madhuri, and we had to get it done. You know, I was thinking that the other day when I was talking in the this thing, the integrated education on women's health, like something which Dr. Shanta Kumari has done in a small way, in the sense she has just only focused on violence, but I think we should escalate it. So I think I'm going to ask one of the five vice presidents to take this challenge. We need to create a nine. I think Sampath has already created that module. Sampath, I want you to do it on a very aggressive manner. You need to create the module which will be there for which where we all will be chota chota in about 9 hours. You must cover everything from A to Z. That
Yes,
9 hour module, if they access on the internet, they should know everything. So we'll create the module for school kids, for college kids, for housewives, for healthcare workers, and this thing. It is this thing. All five of you vice presidents and Madhuri Patel, all of you get together with the chairman and want the module there in 1 month's time. When 1 month flat, I want the module.
I'll send
Okay,
the
this is
emails.
okay, and then we'll put it all over the country. So in that, for example, Shanta Kumar's violence against women, that will be 15 minutes on it. ज्यादा 15 मिनट से ज्यादा बोलेंगे जो सीखा है वो भी भूल जाएंगे सब लोग. So 15 minutes that sexual dysfunction, sexuality 15 minutes. So and certain things. So for example, sexuality in the school children will cut it down. So we'll discuss with Neeraj and all and cut out. So the overall module will be for the housewives, but we'll modify the module for the college girls, we'll modify it for the school children, and we'll modify it for the healthcare workers. We'll also give this module to the general practitioners, the Ayush workers, and the gynecologists we don't have to give. So this is the module has to be done. It was in my mind when I started my presidency. It has to be done on a war footing. तुम लोग सब 5 वाइस प्रेसिडेंट है और सब चेयरमैन है, सोने का नहीं, बहुत काम है हमारे हाथ में. No sleeping. Okay, so this Sampath, you have already
Yes,
created
sir.
the module.
I have done.
You are going to take the leadership and do this module. I want my cartoon from beginning till end. You cover everything. I want
Sure.
it online within a month's time.
Sure, sir.
Okay, so we'll just go to it so that we cover everyone. We say we don't. It is I can't imagine wasting going to a school and the patient. The other day there was some guy who was showing ureteric injury implant following cancer cervix surgery. We should not allow that to happen. There should be no cancer cervix in the first place. It's a shame when someone is implanting the ureter. We have got to such a level that now he is. Had we screened that patient, this would never have happened in the first place. So our energy should be, we are clinicians, our energy should not be spent in teaching the school kid. No, that is not our job. So we have to utilize the digital media. We have to record so that they can access it and have to optimize our energy so that we can give maximum to the community. We are gynecologists. Our main aim is to serve the community through a skill. The rest of it, we have to utilize digital media to achieve our aim. When a gynecologist goes to the school and gives a talk, he's wasting his energy. This can be done by digital media. So please, I want you, Dr. Sampath, you have to take this
Yes, sir.
lead and you have to do it for me. Okay, thank you. So wish you the
Thank you,
very
sir.
best.
Thank you,
Thank you,
sir.
sir. Thank you, sir. Thank you for your pearls of wisdom, and thank you for joining, sir. Thank you.
So Priya, we have to invite Alka
Yeah.
madam.
So now I would like to invite the Vice President East Zone, Dr. Alka Pandey, Madam. She is a very active vice president, and she had been the chairperson Practical Obstetrics Committee of Foxy, where she got the best committee award at AICOG. And Madam is a very humble personality, very friendly and very hardworking, and she's very close to us. She had also been the past president of Patna OBGY Society. So over to you, Madam, for your words of
अच्छा
wisdom.
सुप्रिया जी, बहुत बहुत धन्यवाद.
Thank you. Thank you, Madam.
So I've already told Neeraj what to say about the school children. We also are not aware about many things. When a patient comes and says, I'm having this sexual problem, I really don't, I'm in a fix what to write. So if they say ki many vaginismus, one woman with her daughter came to me and she said, my daughter is having severe vaginismus. She is unable to live with her husband. And I really didn't know what to do with her and what to say. So I think I will have to join all the webinars of Dr. Neeraj and learn really from you. There are many problems which the females are having, which the males are having. And since we are not being taught in our curriculum also, so we are not very much aware of this. So नीरज जी आप ही से पढ़ना है और डॉक्टर पाई को तो हम लोग सब मिलकर सर इज वेरी नाइस, वेरी लीनियंट, वेरी गुड. माधुरी जी तो मेरा नाम ही भूल गई, कोई बात नहीं. माधुरी जी आपसे हम कट्टिस हैं एनीवे. माधुरी जी इज नॉट देयर आई थिंक, लेकिन माधुरी जी इज वेरी नाइस और शी इज डिवोटेड टू फॉक्सी. एंड नीरज जी आपको बहुत 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 ब्लेसिंग्स, सुप्रिया को बहुत ब्लेसिंग्स, and I wish all the best to you and Supriya for the forthcoming future.
Thank you.
And
Thank
really
you.
I have to learn a lot from
Alka
you.
ji, I never forgot
you,
your
madam.
name, but you
अरे
are
मैं
in my
भूल
heart.
गई कट
You are in my heart, so मेरे heart में हमेशा याद रहते हो आप. Okay?
Thank you, Welcome, madam, for your blessings. Now it's my privilege to invite my vice president in charge, Dr. Asa Bakshi, madam. What I say about madam? She is always there and supporting in all our activities. We are preparing so many things are going on from our committee pamphlet. We are coming with the booklet also, small handbook also, and so many things are in pipeline due to all the support of Asa madam. So I welcome Asa madam for your blessings.
Thank you very much, Neeraj and Supriya. Today it is Sangam of two committees, the sexual medicine and adolescent medicine. And I think this is an excellent idea because this overall, this whole subject is very much neglected. So, and overall sexual medicine is neglected, and on the top of that adolescent, so both are neglected. So I think it is a very good idea to bring it together, and I'm so thankful to our visionary, our guide, and our great president Dr. Rishikesh Pai and Madhuri madam for all the time blessing us. And today it's very nice to see all my co-presidents at the same time. We are together. And this webinar is going to be really great, and we all are going to benefit. So with these words, I think I would request you to go ahead. Otherwise, it will really waste a lot of time. So thank you very much once more.
Yeah. Supriya.
Thank you very much, madam, for your wonderful words. And we really got encouraged. And so now over to I request Dr. Giten Sharma sir. He is also Vice President of Foxy and a towering personality with all the medical legal knowledge, and the panel he used to be wonderful. Since years we have been, since the webinar days, we have been doing great panel with you, sir, and lots of wisdom, lots of knowledge we got from you. So we really request you to bless this webinar.
Thank you, madam, for kind introduction. And at the outset, I will like to pay my regards to my dynamic president, Dr. Rishikesh Pai, and Secretary Foxy, Dr. Madhuri madam. there are two committees which are doing miracle this year particularly. See, we didn't know that what to do in sexual medicine committee, but whole scenario has been changed by Neeraj Jadhav. And nothing to say about Supriya madam. She is dynamic. She controls everybody all over India. So what we have seen that the amalgamation of these two committee is going to create miracle today. That I can definitely tell you. The faculty, I pay my regards to my co-vice presidents. First time we are at the same time, all five are there in one program. So Dr. Asha madam, Dr. Sampath madam, Alka madam, and Yashodhara madam. I cannot forget any name. So no kitty with me. Alka madam. And I am looking to the program, and very first time I am seeing all the speakers are dynamic. Dr. Supriya madam, the expert, Dr. Ashwini madam, again, Dr. Shaibia madam, Dr. Chandan Kachru madam, and all the speakers and panelists. I can meet all of you through this webinar today. After so long, I am seeing Tripti Sharan, Queen madam, and all other panelists after Vani madam from. So everybody, I am happy to meet you all through this webinar. I pray for all the success to this webinar, and not taking much time. Thank you very much for giving me this opportunity to be the part of this webinar. Thank you, Neeraj, and wish you all, both Supriya madam and Neeraj madam, a great success and a great future in Foxy in future.
Thank you, Jitendra.
Thank you, sir. Thank you.
Supriya, Yashodhara madam has to leave, so please invite her.
Yes, Sampath madam.
No, Yashodhara madam.
You have to invite Sampath madam.
Yeah, so Sampath madam we will invite later on because Yashodhara madam has to some leave earlier.
Yes,
So just
okay.
invite Yashodhara madam.
Yeah, we have the panel, no, call Yasodhara.
Yes.
Yes, she's there. Yes, madam.
Yashodhara
Now
madam,
I
are you there?
request Yashodhara madam. She has just put off her video.
Yes, yes.
Madam, are you there?
Ma'am is here, but she's not responding. Ma'am is there.
Okay.
Okay, no problem.
Yeah,
Yes,
Madam is Vice President Foxy and a very academician, very disciplined person. I must say she is very particular about her academics. Madam is a very active member of Foxy. And Madam, over to you for your words of wisdom and blessings to this webinar. Madam, just unmute yourself. Madam, just I think her network must be.
Yes, absolutely. Yeah.
Yashodhara
Ma'am, you
madam,
have to unmute. Yeah.
unmute yourself.
I think she's unable to do. So,
No, madam, we can't hear. You are muted. Now, okay.
Okay.
yeah.
So it is my proud privilege to be associated with Dr. Neeraj. I remember when he was going for the chairperson, and he's a very successful chairperson. My regards to Dr. Pai, Dr. Madhuri, my co-vice presidents, because Dr. Geetendra is rightly said that at this platform, you all five are together. Sampath, I am sorry that I had to come before you as a guest of honor because of some of my real commitments. So I requested Neeraj. So Madhuri ji has said everything about this thing, and Dr. Pai has also, as a visionary, he always is a step before. So he's the one who said make a module, it should go to everybody. So I'll say this is the adolescent. Sexuality is very, very important. Supriya, you have done a wonderful job to be associated with Dr. Neeraj, because this is the age in which hormones are there. So there's a hunger. These girls and boys are in a real need of the advice. They need mentors, what to do, because it is not their fault. It is their body hormones are there. So they have to be guided very well how to go with their sexuality, how to go with it. And Neeraj, I may tell you, I have posted your survey in many groups, and many people have filled that form. I'm sure that you are going to get a very good response for the survey. So it is my blessings to you and all the speakers, moderators, chairperson, and panelists. They all are wonderful. I know that this society, this committee is doing wonderful job under Dr. Neeraj. So thank you and my blessings to you. Thank you so much.
Thank you, Yasodhara madam.
Thank you, madam.
Sambat Kumari madam, just your, I don't need to introduce her. She is synonymous with the adolescent. So welcome madam, and just
Thank you, Dr. Neeraj and Dr. Supriya. Our respected President Pai sir and our dynamic secretary Madhuri Patel madam and all my colleague vice presidents and the national coordinator Dr. Apurva and all others. I wish you all the success for this webinar. We will start with the scientific session. Anyway, Neeraj and Supriya is doing a wonderful work. It should continue. Anyway, all the best.
Thank you, madam.
Thank you, madam.
so
Thank
much.
you.
Asa madam, you are presenting survey or? So before panel, we will just release our survey results and then we will start the panel.
Yes.
Yes, Asa madam, please go ahead. Unmute yourself. Madam, you are muted. Gitendra, and please all stay because it is a very important survey. And we need your inputs. Alka madam, please stay.
Can you
1
see
minute.
my screen? Is
No,
my
No,
screen
Asha.
visible?
No, madam.
No? No?
No.
1 minute.
Asha, we can see Jitendra Sharma in the screen.
1 minute. I'll have to bring it on the.
My pleasure.
Now you can see or not yet?
No, not yet, madam.
Then you have to give me some time.
Yeah, okay. No, we will.
Or Neeraj, can you project it from your side?
I'm trying. Let me try. Because I have not pen background and I cannot make my skin smaller. So that's why it is an issue.
1 minute, I'll call it up.
Okay. No problem. We will do it after panel, madam.
Yeah,
Okay.
we can do after.
See, I forgot to tell that the program in which two great MOCs are there, Dr. Charu madam and Apurva, it is going to rock.
Yes.
Yes, sir.
So, Asa madam, should we start with the panel?
1 minute, I'm just
Okay.
trying. Just
Okay.
मैडम ट्राई करते करते खुद ही गायब हो गए.
I think she has some net issue. Sampath madam?
Yes. Yes,
Very
Neeraj.
Neeraj, for your information, I
Yes.
have received not less than 5 to 6 calls from different social organizations.
Okay.
And everybody was telling me that ऐसा survey मत कराओ please.
I know. Even call went to the Pfizer also. And
Yes.
but it's very important survey because Supreme Court is, High Court is discussing this issue. So why we should also discuss this issue, na?
So the reason of discussion is that in all over world, there is nowhere the age is 18.
Yes.
Maximum age in any country is 16.
16. Yes.
So
Absolutely.
Sampath madam, what to do?
We'll proceed with the panel. I don't have the
Yeah.
time.
Yeah.
The survey, but the
So,
results I don't have.
I hand over for further proceeding to Dr. Apurva Kumar Datta and Dr. Charu. Please,
Yes.
our MOC.
Yes.
go ahead with the
Two
further
young and brilliant MOCs are there. Dr. Charu Modi, he was the E-Zone coordinator of Adolescent Health Committee, FOXI, and also she is the chairperson of POGS Adolescent Health Committee. And Apurva Kumar Datta, he is also a very young and dynamic upcoming youngster who is going to be having a good future. So both of you, let's hand over to both.
So much. Thank you so much.
Yeah, you are in adolescent committee. All of us are young.
Yes, yes, madam. Starting
I'm
from
not
you,
able
we all
to
are young.
share. My share screen is disabled.
Oh.
Acha,
Shall I
Neeraj sir,
proceed?
you have to make, because I think ma'am is rejoined, so you have to make its co-host. Neeraj sir, please, Neeraj sir.
He's on 4.
He's busy.
Neeraj sir.
Hey, you can make, man. You are
Unmute,
also
sir.
a co-host. No, you can make him a co-host. Make her a co-host.
No, only, sir, ma'am, only the host can make the co-host. So, Neeraj sir, just 1 minute. I give a call to Neeraj sir.
Yes, Apurva, yep, I can hear.
Can
I
Dr.
Sir,
cannot
please
join.
make Asha
I
ma'am
cannot
co-host.
share my screen.
Yeah, please make
Okay,
Asha ma'am
okay,
co-host.
okay. One minute.
Yeah.
Yes, Asa madam.
Make
Now you are post.
देखो ज्वाइन होता है ओके ओके फिर इसके बाद मेरा सर्वे बाद में कर ठीक है ओके
Hey, this presentation I have, Asha. You told
Okay.
some survey, no?
survey you want me to do survey first
That
Yes,
one
yes,
you
madam.
was telling. This
Yeah,
I said,
Gitendra and all are there, so we can discuss it better.
PowerPoint निकाल देंगे
he was telling about the survey only.
yeah okay survey आया
Yeah.
No,
survey is there
No, adolescent sexuality.
minimize करके करना पड़ेगा ना
Close that.
It's on adolescent sexuality.
Usko stop share karke, then you have to do the survey. You'll have to first stop share for this.
क्लोज करना पड़ेगा पहले
close कर देंगे
अभी हो गया क्या कुछ?
नहीं अभी भी नहीं आया आएगा
Yes,
तो
आ गया मैडम.
आ गया मैम आ गया.
Yes, ma'am.
Yes ma'am.
अच्छा ठीक
Yes, madam, go ahead.
Yeah, I think Neeraj has picked up a very good issue, and that is the issue for age of consent for sexual relationship. Because recently there has been talks going on, and especially in the Bombay High Court has said that several countries have reduced the age of consent for adolescents to enter into consensual sexual relationship. And it is high time our country and parliament are also cognizant of the happenings around the world. And especially the single bench of of Justice Bharti Dangre, they suggested that we have to really think about it. It's a very important issue. And in India, the age of consent has been increased over the time to up to 18, and probably one of the highest ages globally, as majority of the countries have set their age of consent in the range of 14 to 16 years. And sexual autonomy, what does it encompass? It encompasses that we have right, we should see to the right to engage in wanted sexual activity, at the same time right to be protected from unwanted sexual aggression. So both the things have to be balanced, and only when both the aspects of adolescence are recognized, then human sexual dignity can be considered to be fully respected. And that is the main issue that has been discussed. And a decade ago, in India, a new law has been introduced, and that is the POCSO Act, which is there to protect the adolescents under 18. But many adolescent boys are in consenting relationship, and they find themselves in the wrong side of law. And now there are growing calls to take a fresh look at the age of consent and decriminalize the teenagers who have sex, because that's a very natural phenomena. And we are all having this Western influence. So it is very difficult really to constrain them. And we have a very big population of adolescents, almost 253 million adolescents we have. And in India, though the premarital sex is taboo, but still the surveys reveal that a vast majority are sexually active. And in a survey, it was found that more than 39% of women had sexual intercourse before they turned 18. And 10% in the age of 25 to 49 years age group said that they had so before they were 15 also. So, and we also know that some girls, they mature early and some girls, they mature late. So that could be. And the researchers from Enfold Proactive Health Trust, Child Rights Charity, they studied 7,064 POCSO court judgments delivered between 2016 and 2020 in 3 Indian states, West Bengal, Assam, Maharashtra. Nearly half of the cases involved girls who were already 16 to 18. So they were like, means in the higher adolescent range. And this report released earlier this week that almost 25% of these cases were in the romantic category. So that really needs to be looked into. So if the numbers are collated from all across the India, the report says they would be a lot higher, as tens of thousands of POCSO cases reported annually said the offenders were friends, online friends, or live-in partners or pretext of marriage. So criminalizing adolescent sexual activity, which is perfectly normal, shows the law is out of sync with reality. So it's very important to be practical. And this mostly the reports that are lodged, they are lodged by the parents of the girl who has been eloped. And then there are lots of charges of harassment and kidnapping, and the couple gets embroiled in criminal justice system. Such criminalization can give grave consequences. So with this thing in mind, we decided to do a survey. And in this survey, the age of consent for sexual relationship was considered. And we sent the Google form to all Foxy members and asked them to submit their response. And there were two main questions. One was, do you think age of consent for sexual relationship in India should be reduced from 18 years? And 257 said no, and 180 said yes. So this was the graph, and here 58.8% said no, and 41.2% said yes. So it's, see, 41.2 is not a small number. So that needs to be really considered. And then another question was, according to you, what should be ideal age of consent for sexual relationship? So above 18, 236 voted, above 16, 120, above 17, 41 voted, and above 15, 40 voted. So this was the this is the pie chart where above 17, where mostly said above 18, 54%. But then there were others who said it should be to 9.4% said it should be above 17. 27.5% said above 16, and 9.2% said above 9.2 above 15. So this was the overall view. So I think this is a very practical survey which was made, and I would like to congratulate Neeraj for taking the initiative, and to Dr. Rishikesh Pai and Dr. Madhuri Patel for guiding us. So I think now we are open to the discussion.
Yes. Dr. Gitandra, are you there?
Yes, yes.
Yes. What's your view?
So basically, I will like to tell one thing,
Yeah.
that if you go to the definition of law, so one of the biggest lawyer, he said that law is an instrument of social engineering. So whenever there is any discrepancy in the society, to correct that discrepancy or the problem of the society, the law comes, law is been enacted. So we all know why PCPNDT was enacted, because there was change in ratio of male to female. So in the similar way, when there were multiple complaints of atrocities against children, there was discussion in the government, and government took similar kind of view from the society. And ultimately, they reached to the conclusion that there is a need to protect children below 18 years. And that's why age of 18 years was put in the POCSO Act. Although in IPC, Indian Penal Code, section 375, exception number 2, they give advantage to a lady who is married in between 16 to 18. But multiple disputed decisions have come from the Supreme Court, we all know. But ultimately the special act, whenever there is a special act, which is always above the Indian Penal Code and other decisions. And in POXO Act, it is clearly mentioned that any child who is below 18 years, if any sexual assault will occur against him, it will be punishable. So we should keep in mind that till date, POXO is there and we have to follow the POXO Act. Although there are multiple decisions, the recent decision from Justice Chandrachud, 3-judge bench has come where it is mentioned that the child above the 16 years should be given the advantage and should be allowed that if I am not ready to give my name to the police person. So suppose as per POXO Act section 19, it is mandatory to inform the name of the patient to the police. But if patient denies that I do not want to inform my name to the police, then doctor should not inform. That kind of judgment has come. But I don't know whether this 3-judge bench judgment of a Supreme Court will be above POXO Act or not. It is a debatable issue. So we have to follow POXO Act till something concrete comes. And these type of laws are being enacted only after doing proper surveys from the society. And POXO, we all know, is been recent act, came in 2013. So every year or within every 2-4 years or 5 years, we cannot change our stance. And it is not a good idea to change our stance. So according to me, 18 years, which is as per law, is okay to me.
Sampath, madam. Unmute yourself, madam. Unmute.
Yes, Neeraj.
Yes.
And Jitendra Sharma has told as a medical legal committee chairperson, but practically because of the POXO Act, all are afraid. But I think it should be 16. Because girls, we can give advice, but we cannot go and so according to me, the age should be 16 only, and the POXO Act also has to be revised. That is the reason our medicos are afraid. The patient, if comes, if unmarried, less than 18 years, first thing, what to do, how to do, it is the problem. So I am thinking 16 should be the ideal age, Neeraj.
Fine.
Sir,
Madam?
then sir, can I interfere?
Yes.
Intervene.
Yes.
If the age for sexual relationship is 16, then why that lady should not be allowed to marry at 16?
Yes.
Why the age to marry is 18? It should also
Marriage
be
is
reduced
not
to
an
16.
indication, Jitendra Sharma sir. Marriage is not at all an indication nowadays. Even if the patient comes, it is not an indication. Okay.
No, but it should also be reduced then.
Yes,
No,
definitely.
because that is not acceptable. Because for 920,
Dr. Sampath, a little bit confrontation here because the areas of the brain are still to be, they are pruning. So even the biological age for sexual activity is not very, that's why most of that, like Dr. Kitendra said, most of the countries don't have 16 years. They're not developed.
No, most of our 16 years.
Totally abstract. There's no reasoning. So reasoning comes with age. So that's why the 18 years is acceptable.
No, after if I am not wrong,
and then
most of the countries,
teenage pregnancy is going to increase a lot.
14 to 16. 16 is the cutoff most of the countries.
Many
Madam,
countries.
18 is acceptable in our society with no contraception awareness.
But
everything is correct.
That is because of we are not having sexuality education. Main need is sexuality education. Then if there is a proper education, then all this worry will be over. And because consensual sex, when anything happen, the boy and the life of the boy and the girl will finish. So because so many problems they will face. So main issue is that forcible sexual act is definitely another thing, but consensual sex should not be there crime.
Sir, can I add one thing?
Yes.
Under Indian Contract Act, the age of majority is considered 18 years.
Yes.
So the person who is below 18 years cannot contract, and contract done with minor is void ab initio, according to Dharmadas versus Mori Bibi's case. Right. And that is a landmark case. So when the person cannot contract, how can that person give the consent for the sexual intercourse? That cannot be understood. So even the age of doing contract should also be reduced. simultaneously age to marry should also be reduced.
No, marriage is a different thing because it will lead to so many teenage pregnancy and so many other issues. So
Marriage is a different thing.
So when you think that there is a problem with teenage pregnancy, then after sexual intercourse, how can you believe that somebody will not become pregnant and there will not be any danger to her life?
Sampath,
That only we have to counsel, sir. That
Yeah.
I think we are mixing two things.
we should counsel.
Law can never be a deterrent to any adolescent. So we are mixing two things actually. Adolescent sexuality, I mean, it is just we are trying to change things. We have to prevent unchecked adolescent sexuality. Law is different. Law is something different. If there is a law that you cannot steal or run, that doesn't mean you will not put a lock in your house.
Madam,
So
law is always deterrent. If you
Okay,
give
okay,
the
no.
definition of Austin,
It will be a
it
long
says that
discussion. No,
law
it's
is
okay.
law is
Yeah.
a sovereign command which has sanction behind it. And if
Okay.
some
that
law
is
do
for
not have
administration,
sanction
sir.
behind it, then it cannot be a law. It cannot be implemented.
Okay. Asa madam, your input.
I think it should be more than at least if POXO Act should not be applicable if it is a consensual act.
Yes.
Then it has to be a little bit flexible. We don't say that yes, you advocate sex after 16. But what I'm trying to say that if there has been a case where there has been consensual sex, then the POXO Act should get milder and consider that thing in their judgment. I think that is what is my
Yes, ma'am. They should not be treated like criminals.
Ashwini madam, your input.
Yeah, exactly.
You would like to. Yeah, Ashwini madam, unmute yourself. Ashwini madam, unmute.
I remember when I was chairperson of adolescent committee, the age was 16 only to give consent for sexual act, and for the boys it was 18 years. I think it was fair enough. Means we never had any issue when the girls used to come, even they were 16 plus, and we used to give them OCs. Otherwise, now we cannot give anything to them for contraception because the age only is 18. So they in between, if they come, we cannot give them any advice. So I think this is a deterrent, and we should go back to that 16 years and 18 years age of consent. And marriage is a separate issue. So marriage can be 18 and 21 again.
Madam, which act?
And now again the issue is whether it should be same for the boys and the girls.
Madam, in which act? In which act the age was 16? Tell me. At your time, before 2013, what was the act which says that 16 years is the age to give the consent for the sex?
It was
there was no such act. Tell me which act. Tell me which act. There was no such act.
No, but there was nothing like rape. If it is
Madam, there was only exception number 2 in section 375, which only said that only pregnant, only married woman, if does sex at the age of 16, then she should not, it should not be considered as rape. But for unmarried girl, the age was 18 only previously also.
No, it was 16.
16 kabhi bhi nahi thi.
16 it was less.
No.
Now they have made it more.
Okay. We are putting debate on the rest because we have so many things lined up. We have a panel and then talks also. So thank you everyone for your inputs, and I hand over to our MOC Apurva and Dr. Charu. Apurva, are you there?
Neeraj sir and Supriya ma'am, with due respect and permission, मैं कुछ बोलूं?
Okay, बोलो चलो.
Whatever age limit they put for the children, that is fine. They should put age limit that doctors more than 100 years of age only have to report to the police. That age limit should be put because doctors are getting punished unnecessarily. Either you are coming in cross with the law or the patient is running away. Either way, the doctor is at a loss. So that is the thing that they should plus at least don't hold the doctors responsible for what society is doing, which they are doing in all fields. So this is one more additional burden for us.
Okay. Well taken. So without wasting much time, we are proceeding further. Apurva and Charu, please.
Yes, sir. Thank you so much, sir. After this very intriguing discussion over adolescent sexuality, we now move on to this panel only, which has been entitled Adolescent Sexuality, and we have wonderful moderators to moderate this panel with a wonderful esteemed panelists. Our two moderators are Dr. Sampath Kumari Madam and Dr. Asha Bakshi Madam. We have an expert, Dr. Ashwini Bhalerao Madam, for this session, and to formally introduce a bit shortly, Dr. Sampath Kumari Madam is the Vice President Foxy, and
already introduced Charu.
Yes,
You
yes.
cannot finalize.
yes, Madam. And Asha Bakshi Madam are two vice presidents of this, will take this panel to a greater heights, and we all are in fact really eagerly waiting for that. Over to you, madams.
Sapura, please welcome all the panelists.
Yes, yes, sir. Yes, sir. So at present, first of all, it's really an auspicious day for me, because I think our dynamic Foxy President, Secretary General, all the Vice President are there, and they are coming for blessing all of us. And really the wonderful discussion what is going on, and really it's give a lot of message to all of you, all of us. So now I'm really very excited for this wonderful panelist with two great moderator, and personally both of them are very, very dear favorite of mine. Asha ma'am and Sampath ma'am. So, and we have a wonderful panelist, Dr. Ruma Sukla ma'am. Doesn't need any introduction. Ma'am is the past president of the Indore Society and an active member of Sexual Medicine Committee. She is a practicing sexologist. Dr. Sama Sultana is again the young girl and a young gun of our committee, and she's a media in charge. Thank you so much, Sama, for coming here. Seema Sharma ma'am, again a very dear senior and friend of mine. Ma'am is a practicing sexologist, and ma'am is a co-founder of a wonderful NGO Pratishandi, which is actually deal with the adolescent sexuality, and I am blessed to associated with this NGO. And again, very dear senior Dr. Vani Puri ma'am, our North Zone coordinator of the Sexual Medicine Committee, a very senior consultant from the Ghaziabad. Then again, the Queen ma'am. What about you, ma'am? Ma'am is the one who introduced me in the Sexual Medicine Committee. So thank you so much, ma'am, for all the blessings, all the love. And ma'am is our East Zone coordinator. So over to our both.
Bye bye.
Sorry, yeah. Tripti ma'am, people are saying you are a obstetrician turned author, but I am saying you are an author turned obstetrician, because I am a great fan of the writing of your books, and especially being Radha, my favorite book. So thank you so much, ma'am, for coming, and over to you all the
and Ashwini madam is the
yes,
expert.
we have a Ashwini Balera madam, we have an expert with us. So we all know how much work she has done in the field of adolescence. So we are blessed to have her in this panel. Welcome, madam.
Yes.
Thank you so much.
Neeraj, can I share the screen?
Yes, madam. Yes, madam.
Asha Bakshi has started.
Yeah, I've started on.
Yes,
Yeah.
okay. Then you go.
Yeah. So Sampath, you start.
You have to change the slide now. So
Yeah.
welcome, panelists. As all of us know, the term adolescence.
Can you see me?
Yes, Asha, I can see that. The term adolescence is from the childhood to adulthood. That is during the progression of the secondary sexual characters. We consider them as adolescents from 10 to 19 years. Next slide, Asha. Asha, next.
Yeah. Categorized as early adult. Can you see this?
No, you have to change the next slide.
No,
It's
we are
not
not able to.
coming?
No,
Yes.
maybe it will take time little bit. Or Sampath madam, you can.
Yes, I will share. She has made some changes for her.
Okay.
Asha, can I share?
Dhaval. Yeah, I think I'll have to stop because
Yes, now it's
not
okay.
coming. You
Yeah,
could
it's
not
coming,
see. No. You
Asha,
can see?
you hear? It's as per WHO. Hello, Asha.
Can you see?
Yes,
Can you
we
see
can.
now or no?
Next.
Yeah, I'll
Yes,
stop
yes.
my share. I've stopped sharing. You want me to share or no?
Sampath madam is sharing, I think.
Okay. Otherwise, I'll try once more.
No, I have shared, Asha. It's not going. What happened? Yes. Thank you, Asha. First of all, I welcome my co-moderator. This is a change from childhood to adulthood. It is from 10 to 19 years as per WHO. The adolescents are divided into early, middle, and late. 10 to 13 years, development of secondary sexual characters. 14 to 16 years, new relationship to the peer group, attracted by the opposite sex. And late adolescent, 17 to 19 years, they need a distinct identity and they have a well-formed opinion and ideas. And why we are much bothered about the adolescents is India's population, it is 253 million, 22.7% of the population, highest in the world, our Indian adolescent populations. As per literatures, it will increase to 40% by 2030. This is the Indian statistics. Early marriage, 26%, still less than 15 years, and 54% less than 18 years. 20 to 30% adolescent boys are sexually active, and 10% adolescent girls are sexually active. And about the condoms and the contraceptives, 49 to 50% of girls and boys are aware of this contraceptions. 4 to 5% are drug abuse, and 50% of all HIV positive new infections are in the age group of 10 to 25 years. The adolescent abortions are 1 to 4.4 million. With this, we will go with the adolescent and the sexual, what is happening. I think Dr. Ruma, you will be in a position to tell what are all the changes that happens during this adolescent period in a girl.
Good evening to all, and thanks to Dr. Neeraj and Supriya for giving this opportunity. Actually, adolescent is the most tender and critical age of transition. And India has the biggest number of 253 million population of adolescents. 1 out of 5 is between the age of 19 years. During this, there are anatomical changes, physiological changes, and psychological changes. Anatomical changes, the girls' ovary starts functioning, uterus get matured, they start menarche, and they start ovulating. Similarly, in the boys, they start having sperm productions, there is erection and ejaculations also. And for physiological changes, these menstrual changes and ovulations occurs. For psychological changes, these class are having keen interest for the other gender. They start masturbating. They are having, some of them, they become homosexual, heterosexuals, and there are lots of psychological changes occurs during this period. They start experimenting with sex. So we have to be very careful about them, and we have to tell them in advance what are the changes they are going to face.
Yes, Ruma, madam. And sexual means it doesn't mean only the coitus. As you told, it includes physiological factors, pathological factors, and the psychological factors. Oh, something is wrong. Asha, can you proceed? Or
yeah. So what are the influencing factors in the youngsters, Dr. Sharma?
Yes, good evening all. So influencing factors may be many, and the lack of sexuality education and knowledge among the adolescents, and also the family exposure and parents limiting their adolescents to get exposed to such data, and also the background family size, nuclear family and joint family, whereas in a joint family, always elders are back of these adolescents, changing their, they will be knowing their, how the adolescents are changing behavior. But here in the nuclear families, they have no time at all to consider the adolescents. They're changing their way of talking or way of behavior, way of dressing. There is no time to consider, and their attitude towards the sex. And also a lot of films are coming, lots of internet, or they are dumped with all the data unusual on the internet media. And also the educational status may influence, and also the beauty consciousness in the adolescence is changing the way of impact in their mind about the sexuality they should have, and also materialistic attitude and generation gap and all the psychological problems they have, the stress and all. At most important, peer pressure, if they are doing, we also should do, and the addictions they have and the lifestyle they take up, and the nutritional and the addictions they have, the tobacco or anything, it may influence it all the factors influence me on the adolescent sexuality.
So such a delicate thing, isn't it? You want them to know some things and you don't want them to know many things. So this is the main problem here. And I think, yes, the cultural background, the family background, and a stable family, that really matters, and the peer pressure. These are really very important. Thank you very much. Sampath, let's go to the next slide.
So as Dr. Sharma told, Dr. Seema, how the parents should counsel for about the sexual activity or sexual health to the to a girl. Dr. Seema, how parents should counsel? Dr. Seema is there? Seema Sharma.
Please unmute, Dr. Seema.
Hi, good evening. Can you hear me?
Yes, yes, Dr. Seema.
So, good evening, everybody, and very warm regards to all my seniors. So this is a very delicate topic, something that we teach on and on, through my NGO. So first thing I would recommend is that all parents who have young children need to get ready for this kind of a conversation with their children sometime or the other. We need not wait for them to get adolescents, and we need to actually seize the opportunity whenever it arises. You go for lunch with your children, you see somebody behaving inappropriately, you may just kind of point it out that, well, this is not the right behavior to do. So kind of be direct and what you expect, the children to behave. Another thing is that always parents need to not react, they need to respond. Say for example, you find your child masturbating, your son masturbating or your daughter. So instead of doing hoo, or this is not right and you should not do it, I think you should just let the child be at that point of time. And then when the child is more comfortable, you need to talk to them that, well, you need to close the doors and, you need to be more, have more privacy when you're doing those things. Just because you don't approve of it doesn't mean that you're going to tell your children, well, this is not appropriate, you should never do it, because doing that, your children are going to close on you. And then they were never going to confide in you. And if you make a halla out of, doing something, they were doing this and you found them doing that, they will close you forever, and they are never. And this kind of a thing also leaves a very, very lasting impression on children. So we need to be very, very careful, because this is a very tender age. And, we basically have to be very direct, use the direct body parts, that this is the breast, this is the vagina, this is uterus. Don't say that stock got you or I got you from the hospital. Age appropriate information given in small bites when the child is ready to accept it, and always seize the right moment. You're watching a movie with your child, you see a scene where a woman is being stalked, you can always say that, okay, she should have approached her parents, she should have approached the police. Those kind of things are more taken care of, when you don't put any pressure on the child. So always invite more discussion, always accept your child's point of view, what the child is ready to say, and always have a model behavior. If they see violence at home, they are more likely to adopt it. So parents have to be very, very careful in how they are behaving in the house with the children. So best thing I would say is prepare yourself, start talking as and when your child is ready to hear.
Yes, Dr. Seema, the parents should be friendly. And rather than knowing the details from the media, it is better the parents should talk to them. And if the girl is asking one question, you should lead the questions until what are all, as she told, you should explain with the anatomical parts. So always, you should, every day night, I used to tell the parents should sit with the children and take the dinner. And it is the ideal time you can put leading questions. Who is your friend, a boyfriend, a girlfriend, what are all the things happened in the day, you can discuss in the night. Okay, Asha, would you like to take this? I think Asha is there. Dr.
I think this was really very, very nicely tackled by Dr. Seema. And the next influence the sexual behavior of the youngsters. Queen is the appropriate person because she has got a young daughter. She knows how to deal with these things. So yes, Queen.
Thank you, ma'am. Thank you, Didi. So when we talk about the social factors, there will be overlapping amongst all the factors that we are speaking, all of us. But when we talk about social factors in today's day, I think media plays a very important role because of the widespread availability. When we were children or when my mother was a child, there was hardly anything coming from outside. Only what we get to see ourselves or what we get to see inside the house, at school, while we are commuting to school, seeing on the road. That is what used to be in yesteryears. And today the biggest role is played by the media. So we see on television, we get to see advertisements, we get to see serials and everything which have a lot of sexuality on it. So we cannot hide it from the child even if we want to. And it's not that we want to hide it, but the fact is that the number one player in this particular aspect is the media, because the children are getting to see it, the adolescents. Now, they can be good, bad, or ugly. Some of them, as Asha Didi already mentioned, that we want to say certain things, but we do not want to say certain things as well. But here in the media, we don't have a way to stop it. So even while we're watching a normal serial, in the middle, there might be a condom advertisement. So a child who is 10 to 11 years of age might be a little bewildered. So I remember when I was a child, my cousin, who was much younger to me, suddenly said, is this some kind of soap or something? So I mean, I also did not know at that age, when I was 13, what to answer. But since those days, the media has started taking the upper hand, and now in today's world, we know how much of the importance it has, because we cannot do away with it. Everything the children, the adolescents are getting to see on the media. That is, I think, one of the very important factors. Then peer pressure has already been mentioned, and things like starting from alcohol, smoking. This friend is doing, so why can't I do it? And thereby gradually the nature is going towards sexuality and those kind of things, starting from these kind of things that hush, trying to hide, like smoking and alcohol. You want to hide those kind of things. And similarly, this attraction towards someone, that person has a boyfriend, so why won't I have? It's cool to have a boyfriend, and it's not cool to not have a boyfriend. I'm amongst the losers because I don't have one. So that kind of an attitude I see is there, and peer pressure has a very important role that plays in adolescent sexuality. Now, coming to religions, we know that certain religions are probably a little more lenient in this respect. Certain religions like Islam, probably Protestants amongst the Christians, they absolutely ask they preach to abstain from premarital sex. Certain religions totally ask them to abstain, but certain religions may be a little bit more lenient. So there is difference amongst various religious teachings, culture, and tradition. Now, coming to probably 20 years back, if we would think of India and the Western world, like the US of A, it used to be a huge difference. But today, that difference is gradually reducing. So we are seeing, we could never, when we were students, we could not even dream of living in and all those kind of relationships. Now it's quite common. We have patients coming to us. We all have friends or family friends, or even some of us have relatives who are living in. We could not even dream of this when we were children. Had we mentioned it probably or anything of that sort, my parents would have beaten me up. But now it's a very commonplace thing. So that what I'm trying to say is that the huge difference in the culture from the West in those days is not there these days. It has reduced, but definitely we are much more conservative compared to most of the Western world. I think just a little while back, someone had mentioned, one of our esteemed members had mentioned that, yes, the age of consent should be 18. We are conservative, that's why we are saying so. Otherwise, in most of the countries, we see that 16 or 14 to 16 is the age. And not only that, we see that at 16, so many of the children are already sexually involved. We know it. We have patients. We know people in our family, amongst our relatives, amongst our friends. So it's like Dr. Gitendra Sharma said, no, under 18, there's no question. The law is saying this, that, and the other. But Sambat ma'am has already mentioned, law is saying something, but in practicality, something else is happening. So we have to keep this in mind, that our culture and traditions are catching up with the West, whether we like it or not. So it's high time that we pull up our socks and prepare for it. So we have to prepare our children for the same. And as Dr. Seema already has mentioned, as parents, that's the best opportunity we have, is to be friendly with them and get them into talking with them in this regard, and getting to
impart more of the knowledge about all of the various aspects of it instead of shying away from it. And sex education from the parents, from the school, because nowadays we all ourselves are getting involved in this and going to schools and trying to do it. And just now Dr. Rishikesh Pai has mentioned that we should have a digital media for this instead of us personally going over and spending time. So sex education is also playing a role. And earlier we used to, we used to keep guessing, we used to talk amongst ourselves, but now the schools, our parents are talking about it. So that's another thing. Now, apart from all of this, there's another very, very big medium nowadays, that is the social media. So we have, and every student, right from specifically from the time of COVID, every student got a phone in their hands legitimately. Earlier, they used to, Mama, please give me your phone. Papa, it used to be like that. And since the COVID era, they legitimately got a phone in their hands. And since then, it's played havoc. So now everyone has access to everything. The internet is available everywhere. And there is no way that we can stop them. So if the child wants to gather correct information and play it in the right way, then it's best for him or her. But if they want to go the other direction, then, this internet, the free access, such wide access will also be able to ruin their lives. So we have to be very careful about that, and we have to be friendly with them and teach them how what all to gather from the internet and what to keep aside. So we as parents or as teachers or as social people who are trying to help the society, especially as doctors, we have a huge role to play here. Thank you, sir.
Totally agree with you, Queen. And especially now we live in this digital India. So with digital India, you will get problems of the digitalization. And I think parents and the caretakers, they have to be very, very careful about how the child is using the digital media, and by being friendly and more open, and and let the child confide the things in you. If that is so, then maybe we can prevent this influence. So very nicely said. And yes.
Yes, as she told, the technology is a double-edged sword.
Yeah.
Positive use means it will have a betterment, and negatively used, the basement itself is gone. So
Yeah.
similarly, youth is also a double-edged sword. Now the girls and the boys, they use the smartphones, as Madam was telling, instant messaging, instant everything they can get it. So we should be very, very careful. So now we'll go to Dr. Vani. Dr. Vani, what do you tell the girls and the boys? They should know to tell no. When they want to tell no for certain things, they have to tell no. How the girl or a boy can tell a no? Dr. Vani, are you there?
Good evening, ma'am, and thank you for involving me in this different kind of panel, and very interesting one. So, ma'am, first the counseling is there. We have to talk the talk before they walk the walk. So we have to counsel them, the parents, the teachers, the peer counselors, and everybody, the health care providers. We have to counsel them that straight away they should know how to say no very politely and very strongly and well determined. If they don't want, even if the peer pressure is there, that, okay, I know one girl was coming to me, and there was a group of the girls, and they used to see the porns, and the girl was threatened that if you will not watch the porn, you will be knocked out of this group. And she used to watch the porn because of this pressure, that they will just, neglect her and knock out of their groups. And so this is a peer pressure. So we should train our children. We should counsel our children that, okay, talk with us. We will, allay all the anxiety and all the, the things which has not to be done. Okay, if you don't want to do, don't do it. And give a reason to your peers or somebody person who is asking you to do why you're not doing it. And you can just make a humor also, just to divert the attention. Just make a joke out of it. So the attention is diverted from the topic which has been the subject here. The children can make an excuse as well, and can suggest a different activity that this activity can be done, and ignore the suggestion. And if again there is a force to do the thing which the child is not wanting to do, and which is a pressure, and the child thinks that it is not good to do it, then the child should again say no, and with a reason, and ignore that person or ignore that situation, and talk to the parents, the teachers, and like that. So yes, no is no, whether to anyone, whether to the friends, whether to your boyfriend, whether to a girlfriend, whether even a wife. If it is no, then it is no, ma'am. That is
Yes, Dr. Vani. Hope all of us are well aware of this movie, Pinky movie. No means no, whether it is wife or girlfriend or that. So everyone, whether girl or boy, they should know the meaning of no. So next, finally, what are all the consequences of sexual behavior? Dr. Tripati?
Hi, good evening. Good evening, ma'am. So as we were just discussing, I think the sexual needs of an adolescent is a basic human rights, and we all agree on that. But at the same time, they should be made aware of the consequences of an unchecked adolescent's sexuality, or sexual behavior. So the biggest abuse of childhood is pregnancy. I think we all agree on that, because pregnancy in this age group is always high risk. There are all kind of obstetric complications. They have more risk of dying if the adolescent is pregnant. The higher risk of obstructive labor, PPH, and even later on, these mothers, young mothers, they are not they are not able to very confidently rear up their children also. And I was surprised to know that the children who are born to mothers under 18 are at more risk of dying early at this under 18 years of age. So they have a lot of issues during their childhood, immunization problems, nutritional problems, more exposed to trauma and accidents, and also psychological behavioral problems. So having said that, the other major problem that we see in pregnancy in adolescents is unsafe abortions. Because many a times they don't even realize they are pregnant, and by the time they come, they are aware of it. It's already late, and then they are very scared of going to a doctor, so they'll end up in all kind of undesirable consequences. And we know that unsafe abortion is the leading cause of maternal mortality in our country. And then we've already discussed that the children are always at high risk of these pregnant women. And another problem that they have is a higher incidence of sexually transmitted infections as well as cervical cancers. And even condoms are not 100% protective. More partners, more the early age of onset, more pregnancies, more would be the incidence of STIs and cervical cancers. And beyond that, these adolescents are more at risk of all kind of sexual abuse, sexual violence, domestic abuse, and also commercial sex. They are the ones who get dragged into more because they are more vulnerable to it. And the pregnancy at this age, many of them have become school dropouts. They lose on their education. They're not able to attain their position or the employment status that they were supposed to get. Many of them also suffer from stigma because of a pregnancy at a younger age. So the economic impact is there. And apart from that, there is also this problem of medical problems they have. They can have a lot of psychological issues, fear, shame, guilt, trauma, even suicidal tendencies. Many of them fall into substance abuse, alcohol abuse, smoking, and all kind of these behavioral problems. And medical problems also, they become anemic, they have issues with bone health and malnutrition. So these are basically the consequences of pregnancy and infections, and plus behavioral and psychological issues.
So we
Plus
have
economic fallout and career fallout of this.
Yes, well said. The best thing is to counsel them. What are all the consequences? We can tell them that these are all the consequences and better to avoid. Ashwini madam. Dr. Ashwini madam, you want to tell anything with this? We have completed one round. If time permits, we can go.
I'm so happy that our experts have covered most of the issues and very well covered in the slides also. Only thing I wanted to say is that when we say that you have a right to say no, that we have to use in a positive way. So we have to say that it is okay. If you don't want to keep sexual relationship, it is okay. I mean, many people may feel it is cool, but if you feel it is against your ethics or against your family culture and values, you have every right to say no. You know, that peer pressure is not important. What you feel, what you are comfortable with, that is most important. And this is the way to tell them to abstain. You know, means they are waiting for somebody to tell them that don't do it. It may not, if you feel it is not appropriate, please say no. So even the youngsters, they want elderly people to tell them that don't go and have sexual relations. They are waiting for that no from their parents also. And we feel, you know, how can we tell them, you know, that they are on their own. So I think we have to tell them indirectly that to avoid all these complications like pregnancy, STIs, abuse, you can say no, and that is your right. And this is also cool. To say no is also cool. So we have to tell this to them.
Thank you, madam. Neeraj, do you have time or I shall? Asha?
Madam, go ahead. No
Next
problem.
question.
Yeah, we have a time. No problem.
No problem. Yes, Asha.
So what is the incidence and effect of teen pregnancy, Ruma?
The incidence is about 16 million. The girl of 15 to 19 years, 16
मैंने
million,
पूरा adolescent
they give
section
birth annually.
पूरा बना दिया.
But because of nowadays, the exposure is so much through media and porn, I think the incidences are going more high. And the problem with these that many of them, they go for abortions, about 27%, and these abortions are usually through quacks, and they take MTP pills from the counter sale, and which causes them multiple problems. They have bleeding for many months. They don't take the specialist advice. They don't go for sonography, and they take the medications themselves, and ultimately this causes problem to them.
Yeah, I totally agree with you. And worst is this medical termination of pregnancies. The girls, they take the pills over the counter, and then there are very bad consequences. And many of these girls have ectopic pregnancy, and when they come to you, they are morbid, really morbid.
Yes.
So this is something very serious, and that really needs to be addressed. Thank you.
Yes.
So,
Dr. Sharma.
Dr. Sharma. Yeah.
Asha.
Yeah, Dr. Sharma, what are the causes of teen pregnancy? Why does this occur?
Yes, ma'am. Actually, it is a major problem and the commonest hazardous and pitiable very much due to mismanaged adolescent sexuality, and it may be due to the physical, psychological, and social consequences, and as well early puberty, early marriage, and also the socioeconomic status, unemployment, and as I said, family failing nuclear families like that. They don't go with time, means that they don't give time a lot to the adolescents so that they see the changes in the adolescents and correct them. And much of the rape situations we have seen, and addictions, substance abuse, and also a lot of media is exploiting the adolescents brain, and lot of the school dropouts, as they said, are actually school dropouts, and also who are studying also, they are getting away from the parents to acquire studies. Many of my patients in the first year of their engineering, many of the patients, they have come with teenage pregnancies. They are away from their parents. They are in the village, and they are staying in the cities for acquiring their education, and they are coming up with teenage pregnancies. And lack of sexuality education and knowledge about the availability of these contraceptions, and also a lot of poor educational opportunities, and also poor access to healthcare. And as I see, this situation is more pitiable to the parents as well. When they come to know about this situation, it is very horrible, and they are very much concerned about their self-esteem, and also self-respect, and the respect in the society, and the health of their child, how it will be affecting. It is very pitiable to just discuss with their parents about the pregnancy when they don't know about it, and they come to know when they come here with the scan, and it is very pitiable to the parents as well. So these are all the maybe the causes for teenage pregnancies.
Yes, so it is pitiable situation, not only for the patient, but also for the parents. But I think more for the patient, because especially that type of parents are going to be very harsh on her. So I think we have to protect the girls also in such cases. So yes, and I think most important is the contraception awareness amongst this group. And the problem is that in this group, you can't even advise contraception. So this is a very neglected group, and this really needs to be addressed. So thank you very much. And next.
Dr. Seema,
Yeah.
all of us will be knowing. Anyway, you tell what are all the consequences of teen pregnancy.
I think Dr. Tripti has dealt with most of them already. The physical aspects we are all aware of. In a nutshell, we all understand that teenage pregnancies are very hazardous for the baby and for the mother. It increases mortality, morbidity for both the baby and the mother. Then there are also the physical issues are the pelvises are small, the mothers are not really likely to stick to medication. They forget to take their medicines. They higher incidence of CPDs, anemias, cesarean sections. Babies are small, and like I said, in a nutshell, there is a higher morbidity and mortality for both the babies and the mothers. There are also mental issues that we have also talked about. They find everything very overwhelming. They are still children, and they go into drug abuse, higher likelihood of depression and suicides. And so many times, these pregnancies have happened because they've kind of not yet married, and when the parents come to know, they kind of get them both married early off. So that might mean that the girl especially has to drop out of school. She is kind of getting into isolation at home, and she finds herself totally overwhelmed. And this is one of the leading cases of suicides also, younger people. So I think consequences are both very bad for the mother and the baby and the society as well. So I guess this needs to be avoided at all costs.
Yesterday also we had one case in our hospital, married 17 years, went for LSCS. So we are talking so much about adolescent sexual health, POCSO Act, every act. Still the teenage pregnancy LSCS is going on. So what
Dr.
can we do?
Any comments from Ashwini madam for teenage pregnancy? Ashwini madam, are you there?
Yes. Yeah. So
Yes, yes.
teenage pregnancy, it is a high risk pregnancy, and we have seen that basically the girls used to commit suicides, etc. Because when the MTP services were not there, that was the reason why the maternal mortality also was high, because of the unsafe abortions. And this is the very reason why the MTP Act came in India, to avoid these unwanted MTPs, unsafe abortions done by the DAIs, etc. And this was a very fact that why we went for legalization of the MTP. So our country has been always liberated in these acts. And I don't know, again now we are going back and saying that till 18 years there should be no sexual activity. So we have to be very proactive. I feel our forefathers, our senior doctors, they have said in the constitution very nicely that the partner's signature also is not required for MTP. So we were so forward thinking, and again now we are going back, saying that 16 years should not be the age for consent to give sexual consent and all that. So I feel sorry for our country.
Yes, I would totally agree with Ashwini ma'am. And there was one thing that I am from Lady Harding, and we used to joke that in the 70s, the Connaught Place used to have a cabaret. And in 2018, somebody wanted to start something like that, and they stoned him. That our culture doesn't permit. So in 70s, it was open. People used to go, and and 40 years down the line, people are minding it. So I think I fully agree with you, ma'am. We are going back.
Ashwini ma'am, I can tell you another one thing also. We had last month one case of 17 years with as per POCSO Act, everything. She was given IMT people, and that she is around 7-8 weeks, I think. After she had bleeding, everything was over. After 1 week, she came to our hospital with pain abdomen. So we thought that she must be having some gastritis, and we were trying to give. antacid and everything. Once the patient went out, she collapsed. It was a heterotropic pregnancy. So that is the reason. So a 17-year-old girl, empty people's given. Always I used to tell, before giving empty people, do one ultrasound. It is better. We don't have the guidelines, but
somehow
still
amongst these teenagers, you see more ectopic. I don't know why, but you see more ectopic.
Maybe IPL use.
Yes.
Ma'am, they have more chlamydia and Neisseria infections because these girls very, very susceptible for these infections. And they,
So next question is to Queen. What can we do in this scenario of teenage pregnancy?
Yes, ma'am. Actually, as far as teenage pregnancy is concerned, I think all of us have already spoken quite a lot about it. That first of all, they need to know, starting from the parents at home to the schools and everywhere, that they need to be taught about the consequences of the pregnancy. Tripti has also spoken in detail about the same. So the consequences, how they get pregnant, how they should not get pregnant, all of these factors are very important. So first of all, obviously, what is not desired is a pregnancy in this age group. So how to prevent a pregnancy, and therefore and thereby the entire sexuality education, that is what it is, how to prevent, what are the precautions to be taken. These are the very important things that this knowledge we have to impart upon them, from the school, from where they go to learn, and also at home, both ways. Now, along with that, the infections that they can contract, I think just now even Vani has just mentioned. So all of the infections that they can contract, vaginosis, chlamydia, all of that not those infections, but that they can contract these infections, which can be of very bad consequences eventually. So first of all, that, and how to avoid the pregnancy. Now, no matter how much we talk about it, but some of them, if they do get pregnant, then there is no point that we become moral police and then we start rebuking them. Then we have to treat them so that they remain well and they produce a healthy baby as far as practicable, because we all know that teenage pregnancy has the array of all of the complications. So how much we will try our level best to prevent or avoid those complications. So we have to work our best for that. They need more of antenatal care, more of extra care from our side. The most important thing is that once they have conceived, we should not start scolding them that why did you do this, why did that? It has already happened. So if they now, if it's in a situation that they want to abort, they can abort. That's a different scenario altogether. If it is continuing, then they need adequate care. And then as far as the POXO Act is concerned, that is again a very, very big debate. Jitendra sir has already mentioned, we are always in a dilemma. We, the gynecologists, don't know what to do, because we have to give adequate care to our patient. At the same time, we are restricted by law. So at the same time, ideally, we should inform the police while giving them the care. Now, along with this whole scenario, we are talking about adolescents. So I once a week I go to the periphery of Calcutta, and there I find so many girls married at 15, 16, and before they're 18 they're already pregnant. So what do I tell them? Which POXO do I go to? Which police station do I go to? In huge numbers they are coming with pregnancy at 17 years of age. So the first thing is that if they're coming to us in a marriage state without being pregnant for some other bleeding problems or AUB or infections or something, best thing is to catch them and try to explain to them not to get pregnant right now, with the family, with the husband and everything, trying to explain to them the hazards of adolescent pregnancy. So that is the best thing we can do, because we cannot deny. I would have denied it had I not been to the periphery, but I am seeing them in huge numbers. So we cannot deny.
So I think a lot of education, advocacy, awareness is required to prevent the teenage pregnancies. So,
yes.
And already you have discussed, but a little bit from Dr. Vani, who can do it?
Yeah, ma'am. First, charity starts from home. First, the parents should counsel the child. Then the school teachers, the peer counselors, and we, the healthcare workers, the pediatricians, the gynecologists, the nurses, and also in difficult cases, the counselors, the professional counselors can be contacted too. So, ma'am,
I think social media should be used properly.
Yeah, ma'am.
Because they understand social media. So I think they should be taught through the social media. That is
Correct,
more
ma'am.
important.
Correct, ma'am. Ma'am, shall I speak something, ma'am? I just wanted to speak something. Ma'am, I was going through the data, and there's the evidence says that when the counseling is there, when we do the proper counseling about the sexual education and the sex, which is the basic human right, the comprehensive sexual education, then the age of the sex is increased, and more contraceptive usage is there in those groups, and more of the condom usages, and decrease in the STIs and HIVs. So I will go with the 16 years, ma'am, because if you don't give the contraceptives, if you don't do anything, they will be, involved in the high risk sexual activity, and they will come with more of the teenage pregnancies. So I think that doesn't goes practically. So this is my submission, ma'am. So the other thing is that the healthcare workers, they can counsel the teenagers, and the other counselors also. They can tell about their private parts. They can give the full education about them, the reproductive organs, as madam said. And they're very inquisitive in nature. The adolescents are very inquisitive, and they want to know everything. So I think we should clear their doubts. We should not say, okay, you shut up, this is not your, this thing. We should always clear their doubts. If you don't clear their doubts, they will clear by social media or something like that, going to those sites which are not, which are not very correct also. And counseling about the contraception can be used by the healthcare workers if they are involved in the sex. And this thing, ma'am, and then we should ask the adolescents whether they how they feel about their sexuality, what they feel, to whom they are attracted to, because now we have come to the era that the homosexuals are also there, and we should, if they are, we should know prior, and we can take their care of their emotional and their mental health also, because these are the children which will go into the emotional crisis and go into the depression and all. So we should, choose those, we should mark those children who are, like that, and we should ask them always with the open questions.
Interrupt. Please be very brief, because we have
Yes,
so
sir.
many. Yeah.
Yes, sir. So whether somebody has touched you, which you didn't like at all, whether you have involved in some sexual activity, and all these questions has to be asked. And contraception, shall I continue, ma'am, or?
I think we can go ahead. So let's talk a little bit about POCSO Act. Do you want to talk about POCSO Act, Sampath?
Yes, POCSO Act, it will be continuously going on. I think we will leave that.
Okay, let's leave that. Yeah.
That's all.
Okay, so
This
let's come to
MTP
the
Act,
conclusion. Yeah.
it will not end. So this MTP Act, I think all of us are aware of this.
Yeah,
After
we
24
can
weeks,
skip that
adolescent,
also.
and if
The
it's
one
more than that also, you can have a
sentence can I
medical board.
just add on? I was just, Dr. Vani, I think one very big thing doctors can do is to educate themselves about sexuality, because we have never been taught. And so many times, these youngsters know more than us.
Yes,
I remember a couple of years back, one young girl comes to me and she told me, "Ke ma'am, tell me, we are not having penetrative sex, but I'm having oral sex, but will dental dams help me?" And I had by that time never heard about dental dams. I thought there were some dams which, for teeth whitening or something like that, contraption was there. And later on, I realized it was a piece of latex and people were making out of condoms and all. So many times we are also not aware of, we are not abreast about all these sexuality issues. So before teaching them, we need to know ourselves.
That is what we are trying to, ma'am.
Yes.
Sexual committee.
Yes.
Asha, we had a good panelist and good discussion, I think.
Very nice.
So regarding the sexual act, whenever an adolescent girl comes, ask about partners and sexual practices, past history, pregnancy, and protection. One word from everyone. Dr. Ruma.
Yeah, ma'am, I want to say that for sexual abuse, there was one question. We have it's the biggest role of the mother. They should teach their girl about the good touch and bad touch. And apart from the girl, they should teach their boys also. to the son, how they should behave with their sister and with the other girls in their schools or college. That is very important. And regarding the cervical vaccine also, because the drive is going on, and that is very important to prevent the cervical cancer and all these. So these things should be taught in the girls in the home and in the schools also.
Okay. Dr. Sharma, one word. What will you tell the adolescent regarding the sexual health?
Actually, whenever these teenage pregnancies, such girls come to me, I sit with them for an hour or half an hour and tell them that they should be a volunteer and they should take up the challenge, that they should save themselves further and also their friends, their family members. So that should be our goal, to save the further generation.
Dr. Seema?
I would not tell them anything. I would just be non-judgmental. And I will tell you what I have on my table is free condoms. This is on my table, so I encourage them to just pick it up. And I have also put something like all your sexual queries answered. So, they see this, and I just encourage dialogue.
Okay. So all girls will come to you. Dr. Queen?
Yes. The survey that Asha Didi had shown, 42% and 58%. 42% said below 18 years. I was amongst them, and so many of you also. And so I do not advocate sex before 18, but it is a practicality and we cannot escape it. So it is better to accept it and teach our girls and boys, the generation who are in the adolescent age group, teach them about proper sexuality so that they can use it rather than there is any kind of unintentional abuse.
Fantastic.
So that is
Mani?
Yeah, ma'am.
So what will you tell the adolescent?
Making the parents, teachers, and school partners in the adolescent sexuality education, because they think that if we will talk about sex, if we will teach about sex, they will indulge into sex more. But it is other way around. And my clinic is adolescent friendly clinic, and they are they talk whatever they want. They talk their heart. That is what, ma'am.
Dr. Tripathi?
Hi, ma'am. So, ma'am, just 2 hours back, I was in my clinic. The last patient I saw unmarried girl came with pregnancy. I asked her obstetrical history. So she was telling me in March, I was again pregnant. And then also I took a medical abortion. So this is happening in the heart of the country. And these are knowledgeable people. They know everything about contraception. They have knowledge of everything. Yes. So, in rural people, we say, inko pata nahi, they don't know. But these are the people who are educated people. So we need to teach them responsible behavior as doctor to an extent, even without being harsh and judgmental, as Seema was just saying. And what I, as a mother, I have 2 sons. So just recently, my son joined IIT Roorkee. So I told him 2 things. One, do not get involved with a minor girl, less than 18. It is statutory rape. And second, if your girlfriend ever gets pregnant, please understand, please talk to your mother. I will help you out. I will understand how it happens. I will never be judgmental, and we will help you out. We will help you more than anyone else. So, I mean, we should talk to our children, tell them. And I also told him about, what is inappropriate touch, how he should be vigilant, even as a boy. So these things we have to teach. We have to be very open at home and tell them.
Yes.
And I remember, when my son was small.
Seema, we don't have time. Please, one word from Dr. Asha and Dr. Ashwini.
Madam, one more thing we are leaving behind, that is LGBTQ. It's a we have the
sexuality issues. Totally different subject otherwise.
But very fashionable. It has become very fashionable to talk about it these days.
I would like to say that we have to respect their confidentiality. So, we cannot go out and, whatever they have told us, that they'll tell our other staff or tell some other our nurses who are there in the clinic and make fun of them. I think this behavior is not acceptable. And as doctors, we have a lot of responsibility, and we should be friendly with our all clients, and we have to maintain confidentiality.
Yes, thank you.
Thank you. Thank you so much.
Thank you. Say always give information to the adolescents. Don't give advice to the adolescents. Okay. Yes. Thank you.
Very nice. Thank you, madam. Thank you.
Thank you so much for being such a good co-moderator, and thanks all the panelists for such an active participation. Thanks, Neeraj. Thanks, Supriya.
Thank you, madam.
Thank you so
Thank
much,
you.
Madam Asha Bakshi, Madam, Dr. Sampat Kumari, Madam, and of course our expert, Dr. Ashwini Bhalirao Gandhi, Madam, for such an intriguing panel. We can go on and on this topic. This is so vibrant, so I mean, indulging, but we have to respect time also. Thank you very much, all the learned panelists. Thank you once again. And over to you, Apurva, for further session.
Thank you so much. It's really, my ear is like I can listen to them hours together. It's already 1.5 hours, but it's still like abhi bhi adhura hai. So thank you so much, Ashwini Bhalerai ma'am, our great moderator, Sampath madam, Asha ma'am, and all the great panelists. Thank you so much. So next we are coming with the first talk for the today, and for chairing the session, we have a very senior two gynecologists from Bihar. Dr. Uh, Dr. Sangeeta Pankaj ma'am and Dr. Rita Kumari Jha ma'am. Sangeeta ma'am doesn't need an introduction. Ma'am is the HOD and professor at the oncology, gynae oncology at Indira Gandhi Institute of Medical Sciences, Patna. Thank you so much, ma'am. Thank you for coming and joining us. Next we have
Thank you.
Next we have our Dr. Rita ma'am. Rita ma'am is the past associate professor of the PMCH Patna, and ma'am is the vice president elect of the ISOPAP. So thank you so much, ma'am, for giving us the time. I would like to invite Sangeeta ma'am to introduce our first speaker, Dr. Supriya ma'am. Over to you, Sangeeta ma'am.
Hello.
Yes, Sangeeta ma'am.
Yes, madam, we can hear you.
Yeah, it is my proud privilege to introduce the most beautiful speaker of our Fox Society. Am I audible?
Yes, ma'am, you are audible.
Dr. Supriya is working so hard for the adolescent and sexual health of female child and all the girls. She is going to schools and she is really working wonderful. And whatever I say would not be sufficient to praise her work, the way she is working. And
thank you, Sangeeta.
I'm really privileged to be a chairperson to her talk. And I invite you, ma'am, to kindly start your talk. Thank you so much for giving me this opportunity.
Thank you very much. Thank you very much, Sangeeta, for your lovely words. Now, without wasting, I'll just start with a. Can you see my screen?
Yes.
But it is not in full.
Yes, ma'am. It's yeah.
Hmm.
Yes, ma'am. Absolutely.
One sec. Now, is it okay?
Yes.
Now,
yeah,
okay.
ma'am. It's okay.
So, very good evening to all of you. And since we are very late, I'll straight away start with my topic, that menstrual migraine in adolescents and what is about the treatment aspect. So, migraine commonly affects adolescents, and menstrual migraine often begins in young girls. Today, I happened to go to a school, and when I asked them how many people have this dysmenorrhea and how many feel get more of this menstrual migraine, so many hands were raised. So it was to my surprise. I was not expecting so many people having headache during periods. So if undiagnosed or ineffectively treated, migraine can lead to disability, school absenteeism, emotional or social difficulties, and chronification of headache. Thus, recognizing and accurately diagnosing menstrual migraine, developing effective treatment strategies, both pharmacological and non-pharmacological, and educating both the adolescents and her parents are important in order to minimize the potential early disability of these young girls. So what is menstrual migraine? It is a type of headache that affects many adolescent females. It is characterized by intense throbbing pain that typically occurs during or after a menstrual period. Menstrual migraines are more severe and longer lasting than typical migraines, and they can significantly impact a teenager's quality of life. Women who experience menstrual migraine may also have other types of migraines at other times, but menstrual migraine is very, very typical. The exact cause of menstrual migraines in adolescents are not fully understood, but hormonal changes are believed to play a significant role. During a menstrual cycle, the levels of estrogen and progesterone in a female's body fluctuate. When these hormone levels drop suddenly, it can trigger a menstrual migraine. Additionally, changes in serotonin levels, a neurotransmitter that regulates mood, can also contribute to menstrual migraine. Now, other factors that can trigger menstrual migraine in adolescents include stress, lack of sleep, changes in weather, and certain foods and beverages. Adolescents who have a family history of migraines are also more likely to develop menstrual migraines. So, how do you diagnose? Diagnosing menstrual migraine in adolescent patients is challenging because symptoms can vary between individuals and at different ages also. Headache may not be the strongest indication of adolescent migraine. Symptoms like vomiting and abdominal pain may be more severe and recognizable. A useful way to recognize migraine in teens is to talk to the patients and observe their behavior. You will notice the change. In general, migraine attacks in teens tend to have a shorter duration than migraine in adults. Adolescent migraines attacks normally continue for 2 to 72 hours, but can be as short as 1 hour also. Teens often experience bilateral headaches, sensitivity to light and loud sounds, nausea, vomiting, abdominal pain, and vertigo. Other possible symptoms include lightheadedness, difficulty thinking and focusing, and fatigue. So there are many symptoms like headache that ranges from dull to a severe throb, feeling very warm like they sweat or sometimes chills, sensitivity to light, noise and smells, tender scalp, you feel the scalp, it feels tender, loss of appetite, dizziness and blurred vision, pale skin color, then feeling tired, nausea, vomiting, stomach upset and abdominal pain, diarrhea or sometimes rarely fevers. So symptoms of menstrual migraine usually occurs in the days leading up to a menstrual period and can last for several days sometimes. So what 5 tips you can tell your patients to tackle menstrual migraines? Practice yoga. Actually, in my practice also, I usually don't prescribe medicine at once. Counseling is a part of my daily routine. So practice yoga, meditation, and deep breathing exercises. Drink 1 to 2 cups of any uh, caffeinated drink. Opt for hormone therapy to balance your hormones if needed. Use over-the-counter pain relievers if sometimes they are unable to go to school or really they're having exams. In such cases, then get enough good night sleep. That is very important. When to take your teen to a doctor for a headache? So chronic pain, once she will tell you, that is going to worsen, feels like the worst headache, unusual clumsiness or difficulty walking, problems thinking, seeing or speaking, headaches or vomiting upon awakening in the morning, a stiff or painful neck. If they complain of this, you should see a doctor. The treatment of menstrual migraine involves both acute and preventive strategies. Acute treatments aims to relieve the symptoms of a migraine attack, while preventive treatments aim to reduce the frequency and severity of migraine attacks. Recent treatment guidelines recommend a variety of acute and preventive treatments for menstrual migraine. For acute treatments may include NSAIDs, triptans, and combination formulation of NSAIDs and triptans. So hormonal birth control pills also can regulate hormone levels and prevent the sudden drop in estrogen and progesterone that trigger menstrual migraines. And birth control pills, patches, and IUDs are all available options. Doing birth control pills continuously so that there is no break for a monthly period can be an effective way to reduce menstrual migraine. Most people know birth control pills as a 21/7 day formulation, where a woman takes a pill for 21 days followed by 7 days of placebo, which is when she would have her menstrual cycle. That it is that drop in hormones that precipitates a migraine headache. So if we eliminate that placebo week and have patients take hormones continuously through that in an extended cycle, it helps eliminate those migraine headaches. So triptans are a class of medications that can relieve the pain and other symptoms of migraines. They work by constricting the blood vessels in the brain and reducing the inflammation. Triptans are available in pill, nasal spray, and injection forms. Multiple studies have looked at triptans dosed twice a day throughout a women's period. This approach appears to decrease or prevent menstrual migraine. Women with menstrual migraine and frequent migraine attacks throughout the rest of the month should be cautious about their triptan use in order to avoid medication overuse. Triptan dosing for mini prevention is generally twice daily for 4 to 5 days in the menstrual window. Now, non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen can help relieve the pain and inflammation associated with menstrual migraines. They are available over the counter and can be taken as needed. So what are the preventive therapies? So frequent headaches, more than 4 attacks per month, especially chronic daily headaches, so preventive therapies could be an option. The goal of preventive therapy is to reduce headache frequency, severity, and to reduce headache-related functional disability. Preventive treatment are most effective alongside lifestyle modification, comorbidity management, and cognitive behavioral therapy. Historically, the preventive medications recommended for teens were those known to be effective in reducing headache frequency in adults. Now, coming to lifestyle changes, that are the mainstay of treatment actually for the adolescents. Adolescents who experience menstrual migraines can benefit from making lifestyle changes that reduce their risk of triggers. These changes can include getting enough sleep, managing stress, avoiding certain food and beverages, and staying hydrated. Identifying specific triggers, exacerbating and relieving factors unique to each individual is a key aspect of controlling the migraine pain. The SMART tips: sleep, meals, activity, relaxation, and triggers. So these daily tips may be beneficial in preventing or reducing the frequency of migraine episodes. So sleep, regular bedtime routine with consistent sleep time, then limit naps, no screen time 1 to 2 hours before bedtime, aim for 9 to 11 hours of sleep each night. If having difficulty falling asleep, can use melatonin 5 to 10 milligram to help with sleep onset. So before bedtime, then meals, consistent meals daily, no skipping meals, especially breakfast, you shouldn't skip. Snacks as needed. Aim to drink body weight equivalent in water per day. Each kilogram of body weight equals 1 ounce of water. Bring a water bottle to school to ensure consistent hydration throughout the day. This we have to advise to the adolescents. If consuming high sugar electrolyte drink, dilute with half water. That is advisable. Activity, at least 30 minutes of physical activity, 3 to 5 days per week. Heart rate should be raised, may increase duration and intensity of exercise as tolerated by each individual. Then limit screen time to 2 hours or less per day. Relaxation, as you know, training and biofeedback programs reduces stress and anxiety. So this is really important, like yoga, breathing technique, deep breathing techniques, counter stimulation using a strong, more tolerable stimulus during a migraine to distract from pain and break the pain cycle. So these are the few of the preventive measures and triggers. Recognize the climatic triggers, including dietary, environmental, medication, physical, hormonal, behavioral. These are the triggers that you should know that during those periods, these triggers result in the menstrual migraine. So keep a headache log to identify triggers and track response to the above measures. To conclude, menstrual migraines can significantly impact an adolescent's quality of life. However, with the right treatment, most adolescents can manage their symptoms and prevent future migraines from occurring. Hormonal birth control pills, triptans, NSAIDs, and lifestyle changes are all effective treatment options that can help adolescents cope with menstrual migraines. So with this, I come to the end of my presentation. Thank you very much for a patient listening. Thank you all.
Uh, Thank you so much, Supriya ma'am. It's really, I think, one of the topic which is really neglected. But I have seen a lot of adolescent girl who, miss their schools, miss their, tuitions and everything, and it's negatively impact their life. So you have given it a very wonderfully. Thank you so much. It's really eye-opening for me also, ma'am. Thank you so much. So I would like to invite Rita ma'am. Rita ma'am, please your inputs.
Uh, Thank you, Supriya, for your excellent deliberation. It was very good, very informative, and you very rightly covered each and every aspect of menstrual migraine and its incidence, how it is so becoming so common these days, and what are its causes, and what are the tips to tackle menstrual migraine. The exact identification, and it is a purely a clinical diagnosis by symptoms only. Investigations have a very limited role, though estrogen withdrawal is supposed to be a cause, but I went through literature and found that some genetic basis has also been thought of, and in some cases, magnesium, role of magnesium is also there, and changes in aldosterone level and etc. It has also been considered to be one of the causes. But in most of the cases, hormone fluctuation, not the exact level, is the culprit. And you very well summarized each and every aspect of it, and especially the prevention aspect and the lifestyle changes and the role of smart. You very well described all. And in the cases of acute attack, what should be the treatment? So it was a fantastic deliberation, and we uh, uh, enjoyed each and every part of it, and we get benefited, and especially adolescent. They should be very, they should know about it and how to prevent it and how to take it a challenge, not to get disturbed by this migraine attack, and by lifestyle changes and by smart therapy. Thank you very much, and thanks for the invite, the whole organizing team, and especially Supriya for making me part of this wonderful CME. I also gain my knowledge and by a very informative panel and by your talk also. Thank you very much.
Thank you, Rita. Thank you for
Thank you, Dr.
Thank you
Supriya.
so
It was
much,
an
ma'am.
excellent presentation, and we all are enlightened by your new techniques and new methods, and how to change our lifestyle and how to make the young girls aware to prevent themselves. It was really an excellent presentation. Thank you, and thank you for making me a part of this program. Thank you, Dr. Supriya, and all the organizers.
Thank you for coming.
Thank you.
Thank you very much.
Thank you, ma'am. Thank you to the speaker. Thank you to the chairperson. And I would like to hand over to Charu, ma'am, please, for the next talk. Yeah.
So thank you, Dr. Supriya Jaiswal, madam, for this very captivating talk on a very less discussed subject, that is menstrual migraine. We now move on to another session, which is also very comprehensive, and the subject is very comprehensive, and the topic is also comprehensive: sexuality education, Indian scenario. To discuss this more in detail, we have a very eminent speaker, Dr. Shaibya Saldana, and to chair this important session, we have two very important and very eminent chairpersons who are into this committee, who have been doing all the work all the while. We've been seeing their work every time. And with these words, may I invite Dr. Supriya Arvari and Dr. Pratibha Garg to chair the session. So formally introduce Dr. Supriya Arvari. She is the National Coordinator of Adolescent Health Committee of FOXI, and she's been doing great work. And at present, she is the Secretary General, Thane Obstetrics and Gynecological Society. To co-chair with Dr. Supriya Arvari, we have Dr. Pratibha Garg. She is also a professor in the Department of Obstetrics and Gynecology, GRMC, Gwalior, Madhya Pradesh. And she is the treasurer in Gwalior Obs and Gynae Society. She is also a very great academician with more than 12 publications to her credit. And I'm sure with the able guidance of chairpersons, this session will be is going to be a great hit. Over to you, chairpersons.
Thank you so much, Charu, for the kind words, and please do excuse because I'm in transit, so I may not be very clearly visible.
No,
so the CV for our speaker.
yeah. Can we have the CV?
Actually, there was no CV display in our program.
Supriya ma'am, we
Yes,
in Sexual Medicine Committee are not actually displaying any CV. But ma'am, we are delighted to आपसे एक शेर सुनेंगे और मेरे को लगता है that will be the great introduction to the speaker.
अभी आज मैं शेर
One
की जगह
minute,
मैं पोएट्री सुनाती हूँ आज आपको.
Yeah, sure ma'am.
एडोलेसेंट सेक्सुअलिटी क्या है ना, तो मेरा फेमस पोएट्री जो है मैं सुनाऊंगी कि जैक एंड जिल वेंट अप द हिल टू फेच अ पेल ऑफ वाटर and Jack fell down and broke his crown and Jill came tumbling after. But now with all this discussion of whether, the age for consensual sex should be 16 or 14 or 12. So the new jingle is Jack and Jill went up the hill to fetch a pail of water and God knows what they did up there. They came down with a daughter. So I think that is description enough for this particular section.
let me introduce Dr. Saibia. Saibia
Please.
Saldana started as an obstetrician and gynecologist, but steadily evolving into a sexuality activist with a strong focus on the child rights. While continuing her clinical practice for 25 years, she trains stakeholders like medicos, counselors, police, lawyers, judges, and the community at large. And she is setting up child protection system in the state. So welcome, Dr. Saibia. Over to you.
Thank you so much. I shall keep it short since we are already short of time.
Yeah.
Comprehensive sexuality education first needs clarity as to what do we mean by it. I remember in 2000 when I went to a school to take comprehensive sexuality education, there was this, we spoke first to the parents, and one of the rules we try to follow is talk to the parents and the teachers first before we take classes for the students. And there was this father sitting in the first row with his arms crossed like this and his legs crossed, looking very irritated and angry. And when I asked him, do you have any objections? He said, yes. I don't want my daughter to learn. My daughter's in class 9. I don't want her to learn different ways of having safe sex. And unfortunately, that is what the concept of sexuality education is, how to save sex, how to have safe sex. In another case, a school called us because one of the students went in class 6, he went and told the teacher, ma'am, this boy's got condoms to school. So the little boy who had brought it was hauled up in class and the teacher took him out to the headmistress and he had a condom in his bag. And they said, where did you get this from? And he said, in the bedside table next to my parents' bedroom. So, there was so much like disrespect of children. We have to understand, when we go to schools to talk about sexuality education, what we hear is, oh, no, our children are very innocent. We don't want them to learn this. Or they will say, no, our children come from very good families. They are not like that. Or the third thing is, but we never needed any of this. Why do they need it? And that is exactly the point. None of us probably needed sexuality education. Some of us would have been helped by it, of course, but we are never going to say it aloud. The point is, children did not create pornography. Children have not created media. Children do not create ads which ask children to have alcohol and cigarettes. If you notice, the ads have younger and younger people. It is an adult world which is harassing children. And the least way we can prevent harm is to give them comprehensive sexuality education. What is it? It is actually a process initiated by caring, competent, and knowledgeable adults to protect children, giving age-appropriate, culturally sensitive sexuality education through a life skills approach. What do we mean by life skills approach? Life skills, we all know, WHO life skills, it's about coping with emotions, coping with stress. It's about creative thinking, critical thinking, problem solving, decision making. Negotiation skills, you were talking about negotiation skills. What is that? And once some young people told me, ma'am, you always say how to say no. What about how to say yes? We never talk about how to say yes. We never say as adults, sex is beautiful, sex is wonderful, sex is lovely. It's a great experience. You must be able to enjoy a wonderful sex life. And then you say, your first sexual experience is important. So what would you like it to be? Would you like it to have 2-3 beers too much, smoke some weed and ended up having sex with a guy or a girl who was there with you, and next day you don't want to see that person's face? Is that what you want as your first sexual experience? Or do you choose it with someone who you know, who you trust, with whom you will enjoy talking about the next day, saying, oh, it was such a great thing. Thank you. It was lovely. Do we want to say that? But children often ask, why are we not sex positive? Why is sex all about unwanted pregnancy, MTP, STIs? As many of you gynecologists probably know, I have had so many cases of infertility, presumed infertility, because of non-consummation of marriage, because the girl is terrified of having sex. I had a young man who wasn't having sex, and when I asked him, he said, I read one story, I saw one book where this man had sex and his penis got stuck in the vagina. He must have seen it when he was 12, 14, 15. But that image stuck. And now, even as a 28, 30-year-old adult, he's not able to have sex because that's stuck in his mind. And I think that's very important. I also believe comprehensive sexuality is important to help us prevent sexual abuse and avoid sexual abuse. I think Dr. Seema had mentioned, and some of them had mentioned about the importance of age appropriateness. Some of you, Dr. Tripti, Dr. Vani, were talking about counseling the parents. They are the ones about who can talk to the children. So I believe comprehensive sexuality should first go for the parents and the teachers, and then to the rest. The number of children who have been shamed. I don't know how many kids have committed suicide or gone into depression because teachers have complained to the parents saying, your daughter or your son is going around with this girl or boy. They're shameless. These are things which are so terrible. And unfortunately, if you look at comprehensive sexuality education, less than 1% of those 235 million teenagers in India are getting access to it. They don't get it. The adolescent education program is built on fear, on anxiety. It doesn't help. We talk about good touch and bad touch. Actually, now we say safe and unsafe touch. And that starts at what age? 5 years. 5 to 11 years is the maximum age of child sexual abuse. So we need to talk about this before that. So I think Dr. Tripti was talking about how she talked to her sons about it. All the photographs and pictures on the PowerPoint presentations I have seen today had only girl students. Where are the boys? Why are we so scared to talk to boys? To talk about the joy of sex and the responsibilities of sex, the pleasure and the care. That is not a performance. These are the things that we have to build into our sexuality education program. And that's how we need to do it. And if you look at it, Dr. Sampath Kumari was mentioning, and even Dr. Yashodhara said, the hunger for knowledge. What is adolescence? Going from a child and becoming an adult. And what do we become adults for? A puppy becomes a dog, a kitten becomes a cat, little chicks become hens and roosters. For what? Reproduction. That is the main thing. And to be able to live by yourself on your own. So the main thing for reproduction is sex. So the only thing adolescents want to know about is sex. What is sex? How does it feel? How does one do it? And they have only pornography and their friends who are as ignorant as them to tell them. Because what do we talk to them? How you should dress, how you should sit, how you should talk, what you should study, how you should behave. And they're looking at your face and saying, I don't want to learn about all these things. Tell me something which is useful to me. And I think that's very important. Comprehensive sexuality education has to change first our own mindsets. I'm sorry to say that many doctors, particularly gynecologists, are extremely judgmental. We are very, very judgmental. When a girl comes with vaginal infection, we've already got our minds, ki, haan, she's been up to something. But we never actually, and we ask, have you been doing something? Do you have a boyfriend? One of my patients told me that, why do doctors always ask, are you married? And if you say no, then they don't ask any other questions. Why don't they ask, do you have sex? So my intention is that as doctors, we should have what is called a gender affirmative, sex positive clinic, an attitude towards young people, respect. I know that many of you who have said, the 257 of you who said 18 years is the age for adult sexuality will have a problem with me. One of the advantages of a Zoom call is that nobody can throw tomatoes at me. So I'm really happy about that, because I believe, and this is something I practiced at home with my children, is that by the age of 14, they have to be able to learn to take decisions for themselves. Yes, their brain will become mature at 22, 24. The ability to take effective decisions will happen at 22, 24. We can't change that. But the world is such that we need to teach them to be able to make decisions and to make mistakes. Have none of us made mistakes? We all have. And they should know that a mistake doesn't condemn you for life. There is no problem. When I meet young people and I say they have vaginal infection or something like that, 18, 20, 22, I'm like, well, are you sexually active? And they look at me embarrassed and like, yes. And I say, hello, sex is your right. You have the right to have sex. Do you know that? And they're like, they just look so shocked and so amazed. And then they start saying, I had this problem and that problem. Is this okay? Is that okay? Because it is a right. It's just that below 18, the government decides it's not your right. The government can't decide that. And when we talk of laws, as Dr. Ginendra was saying, that laws are social engineering. Yes, they are tools of social engineering, but I think our society has to change. Because 16, 17, 18, they have the right to make decisions. They have the right to make mistakes. Our job is to help them get through their mistakes, to help protect them. And that's where it starts. And to say no, I think children have to learn to say no first to their parents and their teachers. Because when you learn to say no to your parents and your parents respect you for that, then you can say no to anybody in the whole world and it will work for you. Thank you.
Thank you so much, madam. It was really indeed an eye-opener and a very comprehensive talk on a very, the burning topic, adolescent sexuality and the comprehensive sexuality, especially in our country, in our Indian scenario, wonderfully dealt with it. Thank you so much.
Thank you.
Now, may I invite Dr. Pratibha Garg for the concluding remarks, madam?
Unmute yourself, Dr. Pratibha.
Good evening, all of you. I'm very much thankful and I want to show my gratitude to Supriya Madam for involving me in this very great and unique webinar. Madam Shabia, you have deliberate very excellent and elaborate about the topic. It is very much eye-opening. I just want to add that even today, there is very much opposition against this comprehensive sexuality education in India. We don't have any curriculum. We don't have any school which is providing this kind of education to the children. Even my daughter is studying in boarding school. They don't have any kind of such education, any curriculum based. So nowadays it is a high time to include this education in the curriculum age based, like around 5 to 8 years, 12 to 15 years, 15 to 19 years. This should be a curriculum based teaching, and also we should train the teachers to educate them, and we have to train the parents also to say something to their children, talk with their children, as everybody was saying. We talk with the children. Our teachers should be trained regarding this education, and there are evidence-based. UNESCO has done studies which shows that after giving this curriculum to the school, there is delay in the initiation of the sexual intercourse. There is decrease in the frequency of sexual intercourse. There is reduce in the risk-taking behavior in the adolescents, and there is increase in the use of condoms. So this review also found that there is decrease in this sexuality, gender, and gender-based violence also. Thus, there is solid evidence to add this curriculum in our India also. Thank you so much, ma'am.
Thank you so much, madam. Dr. Supriya, would you like to say
So
something.
no, just to thank Dr. Neeraj, Dr. Supriya Square, and Charu yourself for really including such a interesting topics. And Madam Speaker, please accept my compliments. You have mentioned things with so much candor, and I think that is the take-home message. That first, as doctors and as gynecologists, we should learn to accept it and not be judgmental. Often we may not say judgmental words, but our body language reflects it. So we should, as doctors, first learn to accept that this is the right of teenagers, and we should be there to help them and not to deter them from coming to us for help. Because otherwise, they will learn from all the wrong sources. We don't want that. So thank you very much, madam. It was a real pleasure to listen to your talk. Thank you. Thank you, Charu.
Yes.
Thank you,
So
Purva.
Yeah.
thank you so
Ma'am.
much, both the chairpersons and the learned speaker. Thank you so much. Over to you, Apurva.
Thank you. Thank you.
Thank you so much. After really, this is a eye-opener lecture by ma'am, by Sabya ma'am. Really, and we should learn this so that we need a change in our society. So first, we should change ourselves. Then we are able to change our society. So thank you so much, ma'am. So we are moving to our last lecture for today. And for the chairing the session, we have again two very beautiful seniors with me. My own Dr. Charu ma'am. Ma'am doesn't need any introduction. Ma'am is a consultant at Modi Nursing Home, Patna. East Zone Coordinator of the Adolescent Health Committee and Managing Chairperson of Adolescent Health Committee of POGS. Thank you so much, ma'am. Our next chairperson, Dr. Salini Nigam, ma'am. Ma'am is the director and consultant at Himani Hospital, Jaunpur, and at present, ma'am is the treasurer of the Jaunpur Society. Welcome, ma'am. Thank you so much, ma'am. And I would like to
Thank you.
invite Charu, ma'am,
Yeah.
to invite the next speaker, Dr. Chandran Kachru, ma'am.
Thank you, Apurva. It's a real pleasure to invite my esteemed speaker, whom I'm very fond of, and I keep looking and seeing her post whenever she posts in our group of Adolescent Health Committee. She is none other than Dr. Chandan Kachru, madam. And she, as we know, she is the coordinator of our North Zone Committee of Adolescent Health Committee of FOXY. And madam is also a senior consultant at Cloud9 Hospital, Sector 47, Gurgaon. And she is very fond of adolescent, all the activities related to adolescents. And today also she's going to speak on adolescent vaccination, because often we've been hearing right from our childhood vaccination in children, but nowadays people have started talking about adolescent vaccination also, which is very important, and we all should know what all vaccines can be given safely in adolescents. To highlight all this topic in detail, we now move on to Dr. Chandan Kachru, madam. Over to you, madam.
Thank you, Charu, for a nice welcome to me. You have been a very good friend. And Dr. Sabya is really, she has made the standard so high. मुझे लगता है मैं क्या बोलूं अब. Such a beautiful talk she gave on sexuality and comprehensive sexuality. You know, I talked about say 5-6 years back. I went to European Congress of Adolescent Health, and we talked about male health. Male health is something which nobody talks. And I was really surprised that, ma'am, you have taken this subject of male health, which is very close to my heart, and we should be more talking about it. Thank you, ma'am. Thank you so much. It was a pleasure listening to you. So from a little, going from a very interesting talk to a little maybe boring talk, I didn't expect so many people to be awake at this time to listen to my talk. And we'll be talking about vaccination in adolescents, because this is a topic which is always, neglected. So significance of adolescent immunization is so much that it is very vital. Vaccines are often offered to adolescents to protect them against diseases that have higher morbidity or higher incidence, and during this period. It is also aimed at boosting the waning immune responses of certain vaccines administered during infancy, early childhood, like measles, pertussis, tetanus, diphtheria, etc. With the success of UIP initiative, the average age of few VPDs like diphtheria and measles have shifted upwards. That has also made adolescents more susceptible to these diseases. And the epidemiology of certain vaccine-preventable diseases such as hepatitis A has changed due to improving economy and better sanitation and personal hygiene, resulting in higher attack rates in the adolescents and adults. Another indication of adolescent immunization is to provide protection against diseases like cervical cancer appearing during adulthood. But here I will tell you one thing, that we as gynecologists only are more bothered about the HPV vaccine, but there are other vaccines which at least we should be having the knowledge about. So adolescent vaccine almost is non-existent in India's universal immunization program. Until very recently, the only disease targeted for prevention among the adolescents and adults was tetanus only. However, with the launch of MMR vaccine campaign and the proposed substitution of TT and TD vaccine, 3 more diseases, measles, rubella, and diphtheria, have joined tetanus as the vaccine preventable disease targeted for prevention and control among the adolescents in India. Japanese encephalitis vaccine is also offered to adolescents and adults, but only in endemic districts and few states. So there is a lack of systemic and epidemiological data defining the exact burden of various diseases in adolescent period. The overall focus of the government is to ensure good coverage rate of the UIP vaccines to infants, and even the booster doses meant for older children are not given adequate attention. According to WHO UNICEF estimates for 2017, India has attained more than 99% coverage with 2 doses of TT. So as I told you, TT was very, very favorite, and the rest of it has been just neglected. So Indian Academy of Pediatrics is having a separate adolescent immunization schedule that comprises of 3 broad categories, namely mandatory, that is HPV and Tdap, catch-up, MMR, varicella, typhoid, hepatitis B and A, and vaccines given under special circumstances, that is influenza, Japanese encephalitis, the pneumococcal, and the rabies vaccine. So this is how they prioritize, and these are the vaccines which we can offer to the adolescents in India. So this is how the chart will tell you about the vaccines given at various age intervals. And here you can see the white areas. So here it is the hepatitis B green, then the blue, the Hib, PCV, and influenza. And here goes the meningococcal, Japanese encephalitis. And one by one, I will be telling you about these vaccines. So this is one which is more, pertinent and very important for us. This vaccine, HPV vaccine, is the vaccine in adolescent specific vaccine and should remain at the top of the priority list, considering the significant burden of cervical cancer in India, accounting nearly 25% of global cervical cancer deaths. In 2012, there were 123,000 new cases of cervical cancer and 67,000 deaths in India. The age standardized incidence ratio for cervical cancer in India is 22.9, which is higher than the incidence in Southeast Asia. So few states of India have already started the pilot projects on HPV vaccination. States like Delhi has started it with the availability of highly efficacious vaccines and shortened 2-dose schedule, which should be more affordable and compliant. The use of HPV vaccine should be encouraged. And now the recommended new dose schedule of 1 dose can revolutionize the utilization of the vaccine for prevention. So this is the latest HPV doses recommendation, which was given in April 2023. And sorry for the typo error there. A 1 or 2 dose scheduled for girls aged 9 to 14 years. A 1 or 2 dose scheduled for girls and women aged 15 to 20 years. It was discussed extensively by the PIGO as well as the RCOG, ACOG guidelines. And now WHO recommended it. 2 doses with a 6-month interval for women older than 21 years. And primary target is girls aged 9 to 14 years prior to the start of sexual activity, which is this is very important. And the last one, the latest one of Gardasil 9 can be given to boys as well, where feasible and affordable. So routine and catch-up vaccination is this is what these are the doses which is written on the vaccine information which is inside the vaccines which come to us for usage at the consumer level. But WHO recommendations are upgraded every now and then. The latest was what I told you about, the April 2023. Special situations, immunocompromising conditions, including HIV infections, 3 doses series, even for those who initiate have vaccinations at age 9 to 14 years. Here, the 3-dose series is given. History of sexual abuse or assault start at age 9 years. and pregnancy testing not needed before vaccination, HPV vaccination not recommended until after pregnancy, and no intervention is needed if vaccinated while pregnant. This is one of the most frequently asked questions. Now, you have to be very careful about the Indian vaccine, which is from Serum Institute of India, and there the 2 doses less than 15 years and 3 doses more than 15 years. 0, 2, and 6 months schedule is given. And like I told you, the new Gardasil 9, WHO is of the opinion, even 1 dose at least is sufficient. And the research and guidelines are getting updated every now and then. The second vaccine which we'll be talking about is a dengue vaccination. Though dengue affects all age groups, it is primarily a disease of adolescents and adults. According to recent reports, the majority of dengue cases occur in the age group of 14 to 45 years, with highest burden seen in the 15 to 24 years subgroup. Unfortunately, the only global licensed vaccine, that is Dengvaxia, has got few limitations like poor immune response against type 2 strain of dengue virus, moderate efficacy, multi-dose schedule, effective only in the age group of 9 to 45 years, and most importantly, a real risk of developing the severe disease in seronegative individuals. So you will have to have a dengue infection to have this vaccine. So not very much acceptable, but the research is going on, and maybe in future we'll have a much safer dengue vaccine. Here the dosage schedule is 0, 6, and 12 months. Now there is a tussle between Tdap and TD vaccine. There is no data on the burden of purchases in adolescents in India. Since the data on efficacy, effectiveness of Tdap from our country and other Southeast Asian countries are sorely lacking, it would be more prudent to reserve its use to protect an adolescent during an ongoing outbreak or when an outbreak is anticipated, rather than using it routinely for all adolescents. Tdap should be substituted with bivalent TD, vaccines, which would not only be more judicious but also a cost-effective strategy. So routinely, adolescents are given 1 dose Tdap at 11 to 12 years, and catch-up vaccination is adolescents 13 to 18 years who have not received Tdap, then 1 dose Tdap, and Tdap every 10 years. So mumps vaccine is the next one. The highest incidence of mumps in India is seen in children above 5 years of age, mostly in adolescent age groups. While there is a considerable waning of immunity following mumps vaccination, and time since vaccination seems to be a factor that determines the risk of outbreaks in adolescents, a dose of mumps MMR at 4 to 6 years may not be effective in preventing outbreaks amongst older adolescents aging 15 to 18 years. At least a single dose of MMR is a must for every adolescent, irrespective of their past vaccination status. So the unvaccinated children and adolescents, 2 doses series at least 4 weeks apart, and minimum interval should be 3 months. Now, hepatitis A virus studies in India have shown actually seroprevalence to be between 38% to 92% in different age groups. A higher attack rate was seen in adolescents and adults than younger children in some Indian states. With outbreak of HIV infection, higher proportions of symptomatic cases and even hepatic failures are reported amongst adolescents from different parts of our country. So due to their tendency of some frequent visits to restaurants and eating outside the home, adolescents are more vulnerable to acquire HIV infection. So Zomatos and Swiggies are bringing the HIV infection also. Hepatitis A vaccination should be given a higher priority for catch-up immunization of the adolescents. So they're highly immunogenic when administered to children and adolescents, according to studies using different formulations and vaccine schedules. A total of 97 to 100% of persons aged 2 to 18 years had protected their levels of antibody 1 month after receiving the first dose, and 100% had protective levels after 1 month after the second dose, with very high GMCs, that is a statistical evidence. So catch-up vaccination, unvaccinated persons who age 18 years should complete a 2-dose series. Persons who have previously received 1 dose at age 12 months or older should receive dose 2 at least 6 months after dose 1. And adolescents age 18 years or older may receive the combined. These days we have a twin Rix also, a combined vaccine which can be given. And persons traveling to or working in countries with high or intermediate endemic risk, the hepatitis A vaccine has to be given. Now we come to the hepatitis B vaccine. Adolescents are more vulnerable to get the hepatitis B infection through indulgence in sexual activities, which also facilitates its transmission. Thus, vaccination of adolescents against hepatitis B becomes more imperative. So catch-up vaccination is an unvaccinated person should complete a 3-dose series at 0, 1 or 2 months and 6 months. And adolescents age 11 to 15 years may all use an alternative 2-dose schedule with at least 4 months between doses. And these are the doses like 2-dose series at least 4 weeks apart, 3-dose series at 0, 1 and 6 months. And combined hepatitis A and hepatitis B, like I told you, the Twinrix is also available. Revaccination is not generally recommended for persons with a normal immune status who were vaccinated as children or infants or adolescents or adults. Now, this is a vaccine, typhoid vaccine, which is available and least used, very underutilization. Children aged 5 to 15 years and adolescents are at greatest risk of developing the disease. According to Global Burden of Disease Study in 2016, India had 6.6 million typhoid cases and 66,000 typhoid deaths. 56% of which were among children under 15 years of age. So typhoid infection can be prevented and vaccination is important. Since 2018, WHO has recommended that typhoid conjugate vaccine introduction be prioritized in countries with the highest typhoid fever incidence or high prevalence of antimicrobial resistant pulmonary. Next important vaccine is the varicella vaccine. Now we had the catch-up vaccine for the adolescents. Ensure adolescents aged 7 to 18 years without evidence of immunity have 2-dose series. Age 7 to 12 years, routine interval 3 months, and age 13 years and older, routine interval 4 to 8 weeks. So this is the guide of the prophylaxis of rabies vaccination. Now rabies is something very, very common, and we should be knowing some knowledge about the rabies vaccination. This is a post-exposure prophylaxis in unimmunized and fully immunized individuals. So low risk 5 doses and fully immunized 2 doses can be given, and the dose schedule is like given. So besides the vaccination, it is the importance of the wounds which these rabid animals can give. Wounds must be immediately washed, flushed for 15 minutes and disinfected. And rabies PrEP should be instituted immediately post-immunized exposure prophylaxis and consists of course of potent effective rabies vaccine that meets WHO recommendation and administration of rabies immunoglobulin, and must be applied using vaccine regimes and administration rules that have been proven to be safe and effective. Pregnancy is not a contraindication for this. If rabies immunoglobulin is not available on first visit, use can be delayed by up to 7 days from the date of the first vaccine dose. And initiation of post-exposure prophylaxis should not await the results of lab diagnosis or be delayed by dog observation, which was done in the past. When suspect rabid animals contact occur in areas free of carnivore-mediated rabies and where there is adequate surveillance in place, then post-exposure prophylaxis may not be required. But it's always safe to give. So patients presenting for rabies post-exposure prophylaxis even months after having been bitten should be treated as if their contact has recently occurred. This is very important. And post-exposure prophylaxis should be administered even if the suspect animal is not available for testing or observation. And in areas enzoonotic rabies, this prophylaxis should be instituted immediately unless adequate laboratory surveillance and data indicates that species involved is not a vector of rabies. So this is how we should be giving the vaccine. Another very important vaccine is the flu vaccine. And 2 brands, Influvax Tetra and Flurex Tetra, have received DCGI approval for this uniform dosage recommendation. And it endorses a dose of 0.5 ml per dose in children older than 6 months for these brands. Uniform dosage recommendations shall be extended to other brands also once they get approval from the licensing authority in India. Till then, the manufacturer's age-specific recommendations regarding dose may be followed. 1 dose for all persons aged 9 years or older. So meningococcal vaccine, routine vaccination 2-dose series at age 11 to 12 years to 16 years. Catch-up vaccination age 13 to 15 years, 1 dose now, and booster at age 16 to 18 years. And age 16 to 18 years, 1 dose special situation. Anatomic or functional asthenia, HIV infection, persistent complement component deficiency, and complement inhibitor. Another is meningococcal serotype B vaccinations. Adolescents are not at increased risk at age 16 to 23 years. Based on shared clinical decision making, we have these brands available. In India, it is available as meningococcal ACWY and Menactra, and Serum Institute monovalent varieties also available. So given in immunocompromised individuals. Pneumococcal vaccine, age 6 to 18 years, no history of either PCV or PPSV3. These are the two strains, 1 dose P3, 2 doses PPSV23, administered 8 weeks after PCV and dose 2 of PPSV, 23 administered at least 5 years after dose 1. So next is polio virus vaccination. Adolescents aged 18 years are at risk of exposure to the polio virus with no evidence of complete polio vaccination series. At least 3 doses, administer remaining doses 1, 2, and 3 to complete a 3-dose series. Evidence of completed polio vaccination series may administer 1 lifetime IPV booster. So these injectable IPV dosage is the one recommended. Everyone aged 9 months to 59 years who plans to travel to parts of Africa and South America where yellow fever is a risk needs 1 dose of yellow fever vaccine. If you plan to continue living in or traveling to that country, it is possible you will need a booster shot every 10 years. Now, COVID vaccination for adolescents, we have had a hell of life for our adolescents. They were confused whether they were not coming in the children category, they were not coming in the adult category, and there was a lot of confusion. Then the government, allowed the Covaxin to be given to these. So COVID-19 vaccine with WHO that have undergone clinical trials in children and adolescents are safe and effective in preventing disease in children and adolescents. Adolescents with comorbidities and severe immunocompromising conditions should be offered vaccination. And Covaxin carries an overall favorable short-term safety profile in adolescents. Then observed AEFI rates in adolescents are much lower than that reported with mRNA vaccines, but head-to-head comparisons in the same population are required to generate relative vaccine safety data. Female adolescents and those with a history of allergy need watchfulness for severe persistent AEFIs, and with some of the AEFIs, that is the vaccine specific, persisted at 14 days. A longer follow-up is recommended to strengthen the safety data of Covaxin. We know about the adverse effects of vaccines, the most important being severe allergic reactions, severe immunodeficiency status. We have to be very careful in giving the vaccine. Moderate, or because this is a double-edged sword, you have to give in that, and you have to be very, very careful also. Moderate or acute severe illness or without fever, withhold, and pregnancy caution is always there. And local reactions like pain, edema, or it might give rise to fever. Contraindications, Guillain-Barré syndrome within 6 weeks after a previous dose of any type of influenza vaccine. Persons with a history of severe allergic reaction, especially to egg-based things, and moderate or severe acute illness with or without fever. Severe immunodeficiency diseases like HIV and all, be very, very careful. So what are the best practice guidelines for vaccine administration? Adequate knowledge of vaccines available and their forms, attenuated, live, killed, etc. Spacing and booster dosing. Contraindications and precautions. Preventing and managing the side effects, and safety and proper storage, temperature control, and cold chain maintenance. And vaccine administration. This cold chain is so important that during the polio drive, I myself have seen, the people who came with the vaccine, they used to carry them in their hands and give them when you ask them how are you carrying, they had no knowledge about the cold chain, the maintenance. Vaccine administration, handling of immunobiological material. Vaccination records are important. Vaccination programs like UPI very important, and vaccine information sources like WHO, CDC, Government of India guidelines. The healthcare providers have to have the proper information about the vaccine. That's all. Thank you so much for patient hearing.
Thank you so much, Chandan ma'am, for A to Z of everything about vaccination in the adolescent. Thank you so much. So I would like to take comments from our chairpersons. Dr. Shalini ma'am, your comment, please. Shalini Nigam.
Good evening, everyone. I'm Dr. Shalini Nigam, and
Okay,
I'm
sorry.
really, it's a pleasure for me to be a part of this important webinar. I thank Dr. Supriya Jaiswal, madam, for making me a part of it. And coming to the talk, Dr. Chandan, madam, has given an excellent talk. She has very well covered the topic of adolescent vaccination, very elaborate. And as a gynecologist, it's a great responsibility of all of us because we encounter a lot of adolescent patients in our clinic. So it's our responsibility to counsel them and provide them vaccination, which are important for us. So this way we can benefit them. And I thank again, madam, for such a great talk.
Yes, indeed. I totally agree with Dr. Shelly Nigam. It was very comprehensive. Dr. Kashu has, covered all the immunizations, especially the mandatory ones, the catch-up ones, and the vaccinations under special circumstances. And Madam, you've already very importantly highlighted all those, best practice guidelines, which is very, very important to maintain a cold chain, proper storage, proper transportation, because otherwise the vaccine, even if you administer it, it will lose its efficacy. So it has to be properly maintained, properly transported, and properly given. So thank you so much, madam.
Very
And
important because this is one aspect of vaccine which mostly we don't know, we don't take care of. And like I told you, I saw one small child, was about 13, 14-year-old giving polio vaccine. And it was inside, the temperature was so high, it was about 40-degree temperature, and he was giving polio vaccines to everybody. So he had no idea about the cold chain. So cold chain in vaccine is very important. This is actually a very boring subject for everybody, but I tried to, make it in a comprehensive talk. Not much.
Actually, in our daily practices, we more focus on these HPV vaccines, but we tend to ignore the other ones.
So, yes, definitely. So, but naturally, whenever a patient comes to us, we can, offer them that you should go to your pediatricians and get the vaccinations done properly.
Yeah.
Thank you so much,
For
Dr.
boys
Supriya,
is also equally important and has to be, highlighted and give emphasis upon, because boys are also very vulnerable to certain infections and diseases. So adolescent vaccination for boys is also
one important factor was that HPV vaccine can also be given to the boys.
Right.
So I think Dr. Shabia will be very happy for that. Yes, ma'am. I totally agree with you that male adolescent health is not talked about.
Yes. Thank you so much, madam. Thank you very much. Over to you, Dr. Purva.
Yeah. Dr. Supriya, now what are things? And then we will finish. Unmute yourself.
Unmute.
You are muted.
Unmute yourself. Supriya, unmute yourself. Oh,
Dr. Supriya, you are muted.
Okay. Oh, she's not able to do it.
Okay, Dr. Neeraj, you can do that.
Apurva, just go with the vote of thanks. You can give vote of thanks. Apurva, are you there?
Purva.
Yeah, yes, sir. Yes, sir. Yes, sir. Should I go?
Yes, yes.
Yeah. Okay. So after really this an eye-opener and very, very unique webinar by two committees, by Sexual Medicine Committee and by Adolescent Health Committee, is really, really a wonderful one. And our Foxy president has given the term Badlao, which is actually the theme of this year. So this is really a initiative to have a badlao in our society, so that we can have thinking and changing our thinking of the sexuality and adolescent. So I am really thankful to our respected chief guest, our president, Dr. Rishikesh Paisa, our Secretary General, Dr. Madhuri Patel, madam, our all the wonderful vice presidents, Dr. Gitendra Sharma sir, Dr. Sampath madam, Dr. Alka madam, Dr. Asha Bakshi madam, Dr. Yashodhara Pradeep madam, for really giving us a wonderful time and for the blessings. I would like to thanks to the chairpersons, Dr. Neeraj Yadav sir and Dr. Supriya Jaiswal madam. Without their effort, this webinar can't say the day of a life. So thank you so much. I would like to thanks to my dear senior, my friend, my colleague, Dr. Charu Modi madam, for with me for making this session so smoothly. I would like to thanks to our moderator, Dr. Asha Bakshi madam, Dr. Sampath madam, and to wonderful panelists, all the panelists, to make this a really great discussion. I would like to thanks to all the speakers, starting from the first speaker, the Shabya madam is there, then the Chandan madam is there. So making this a really an eye opener to all of them, and all the chairpersons for chairing the session so nicely, so brilliantly. I would like to thanks to ICOG chairperson Dr. Lakshmi Srikhande madam, and the Secretary General Dr. Ashok Kumar sir, for grant as the ICOG credit point. I would like to thanks to Medisage to give us the technical support. I would like also thanks to all the audience who are attended, and I am just wanted to I want to just announce that it is more than 500 people are joined login till now and watching our program. So thank
That
you
is
to
on
all of
Medisage.
you for
That is on Medisage. Our Foxy will be
Medisage.
plus.
Yeah, that is only on medicine. Yeah, absolutely. So thank you so much to all of you. Thank you so much to all the audience for making this a big success. Thank you.
Thank you so much, doctors. Bhumika here from the project team Medisage. Thank you so much. It was really, really a very informative content going on, and the live delegates have really enjoyed. We had 500 plus live delegates in today's program, sir. So 500 people have watched this, and it's really amazing to be a part of such wonderful programs, and looking forward to collaborate more.
Thank you, Bhumika.
Congratulations to Dr. Neeraj and Dr. Supriya for a wonderful webinar.